Hello everybody, my name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In today's video, I am going to review 70 practice CNA exam questions with answers. Let us begin. All right, number one, what is the most serious problem wrinkled sheets could cause your resident? A bad night's sleep, B, skin tears, C, decubitus ulcers, D, wrinkled sheets are no problem. And the correct answer is C. Wrinkles on sheets could cause pressure on the skin, decreasing circulation, thus causing pressure sores. And another term for pressure sores would be the decubitus ulcer. So that's why we encourage you not to put too many layers beneath your patients and to, of course, have those sheets wrinkle-free. Number two, Mr. Jackson needs help eating. What is the first thing the CNA should do? A, wash your hands and the resident's hands. B, cut the resident's food into small pieces. C, tell the resident where to sit. D, put a clothing protector on the resident. And before you're going to render care, we know the first thing we need to do is A, wash your hands. And you'll also wash the resident's hands before handling food. Number three, Mr. Watson is developmentally disabled. Which of these statements is true? All developmentally disabled residents need help with all of their care. B, they are always unpredictable and emotional. C, they can learn new skills but at a slow pace. D, they always have trouble ambulating. And one of my rule of thumbs is if a question option has always in it, I usually don't choose that one. So let's see what the correct answer is. The answer is C. Each developmentally disabled resident will have different needs, but most are able to learn new skills but at a slower rate than normal. All right, I hope you got that one right. All right, and if you're liking the video, make sure you subscribe to our channel. We try to post new videos weekly, and if you are in the state of Florida, we actually have a facility in Jacksonville where we do in-house CNA training, and that website is fltraining.com. And if you stay to the very end, you'll see that information on the last slide. All right, number four, one of your residents is in traction. Okay, and some of you all may not know what traction is, so I added a photo on the next screen. You should never, A, take the resident's vital signs, B, feed a resident in traction, C, give the resident a bed bath, or D, change the position of the weights. All right, and so this is an image of a patient who's in traction. And so here, they must have had some type of a leg injury that required surgery. And so we have a counterweight down here at the bottom. This is a trapeze, an overbed trapeze. This is what the patient would use to lift their body weight so you can slide the bedpan beneath them so you can change the linens. But as a CNA, you never touch the weights. So the answer for this one is D. The position of the weights can only be adjusted by a nurse or a doctor. Number five, the charge nurse is giving you an assignment. You are not sure how to perform the assignment. You should A, ask another CNA how to perform the assignment. B, ask the charge nurse how to perform the assignment. C, ask the resident how to perform the assignment. Or D, ask another CNA to perform the assignment for you. And it's not going to be D because if it's part of your job role, you have to learn it. And the correct answer is B as in boy. Anytime that you are unsure of how to perform an assignment, ask the charge nurse for help. Never perform an assignment that you're unsure of, therefore putting your resident at risk of injury. Number six, what is the main goal of OBRA? All right, to set standards for safety in the facility. Or B, to monitor the food service department. C, to set up payment schedules for the resident. Or D, to see that the healthcare providers meet set requirements by passing a competency and skills test. And I do apologize. This is my first time really shooting a video since I had surgery. And I think from being, possibly intubated during the surgery, my voice isn't back to full capacity, but I'm doing well. I'm 3 days post-op. So, and I'm back here training my babies who I love. All right, so let's see. Number six is D as in dog. Healthcare providers are responsible for their actions. They need to be well trained in order to give competent care. And so the answer for OBRA OBRA stands for the Omnibus Budget Reconciliation Act of 1987, and this is a nursing home reform act that was enacted by Congress to protect people from abuse in nursing homes. And so that's when they actually started making sure that we had the proper skills and could perform the skills competently. Excuse me. Number 7, when changing soiled linens, what should the nurse aide never do? A, place the soiled linens in the dirty linen container. B, place the soiled linens on the floor. C, wear gloves while changing soiled linens. D, none of the above. What should the nurse aide never do? And you should never, let's go back. I want to look at that one again. You should never do B. All right, so B, soiled linen should always be placed in a dirty linen container and never placed on the floor. Number 8, when helping a resident who's had a stroke, the CNA should dress the unaffected side first, help the resident do everything. C, lead the resident's strong side when transferring, or D, all of the above. So your person's had a stroke, that means that they probably have hemiparesis, half of their body is weak. We don't do everything for our residents. Our goal is to keep them as independent as possible for as long as possible. So I know that B isn't the answer, and if B isn't the answer, that also means that D has also been eliminated. So let's see what the best option is. The answer is going to be C. When someone's had a stroke, the CNA should help the resident begin the transfer with their strong side, and this will facilitate a safer transfer. Number 9, Mr. Jackson is visually impaired. What is the best way to communicate with Mr. Jackson? A, identify yourself before entering the room. B, tap Mr. Jackson on the shoulder and then identify yourself. C, speak in a very low, quiet voice. Or D, teach Mr. Jackson to identify you by your voice. So someone is visually impaired. You want to notify them before you touch them. So the correct answer is A. You always want to identify yourself before entering the room. So you're going to knock. Just because they're visually impaired doesn't mean they're hard of hearing. So knock, get the approval to come in, and then introduce yourself. Number 10, when a new resident is admitted into the facility, what should the nurse assistant not do? Okay, so which one should you not do? A, introduce the resident to the other residents and staff. B, help the resident to find their room. C, call the resident by their first name. D, show the resident where to locate all the call lights. And it's just rude to call someone you don't know, especially if they're older than you, by their first name, especially in the southern states. So what you should not do is C, never call a new resident by their first name until they've given you permission to do so. 11, the Heimlich maneuver uses abdominal thrust, okay? That's those inward and upward thrust to A, remove a blockage from the airway. B, start the heart beating again. That should be C, get air into the lungs, or D, open the airway. And I have my wonderful assistant who helps me, so forgive us that it says A, B, B, B. We know it's A, B, C, and D. All right, so what is the purpose of the Heimlich maneuver? The purpose is A. The Heimlich maneuver was designed to remove blockages from the airway, and you continue doing that until the object is dislodged, or if the person becomes unresponsive, you'll lay them on the ground, start CPR, beginning with high quality chest compressions, and of course, call for help, call 911. 12, to help a resident from becoming dehydrated, the CNA should A, tell the resident to drink fluids only when they are told to. B, provide fresh water and other fluids each shift. C, discourage residents from drinking when they are tired. D, only let residents drink fluids when they are eating. And so if we want to prevent this person from becoming dehydrated, we want to encourage fluids and encourage it often. So pretty much every time you do your hourly check, you'd be asking, hey, Miss Eunice, would you like some water? So the correct answer should be B. Fresh water should be provided on each shift. And as a CNA, as a nurse, I'm just begging you CNAs, just make sure there's always some water in the picture. You just don't know how much our nurses appreciate that. I know you sometimes think that we don't do a whole bunch, but when we have 20 pills that we have to give a resident and then we have to walk back out to turn around to get water, it just, just working with a CNA who understands the full scope and how we work together as a team, we really appreciate, so not only does the patient appreciates having fresh water. The nursing team appreciates the fact that you have put fresh water in your residence rooms also. Number 13, Mr. Jackson has had a small stroke and is weak on one side, but can still support his weight. What is the best device to use when transferring Mr. Jackson? All right, so a mechanical lift is A, B, a sliding board, C, a transfer belt or gate belt, D, you should not transfer Mr. Jackson. This person can still assist you. He can still support some of his weight. So we don't need a mechanical lift. We don't need a sliding board. And of course, we're going to transfer a patient. We don't want them in one position all day. So the best answer is C. Since Mr. Jackson can still support some of his weight, a gate belt can be used in transferring. 14, a coworker said that you broke a client's glasses, which is not true. This is an example of abuse, B, defamation, C, neglect, or D, assault. All right, and so we know it's not abuse. It's not neglect. The patient wasn't injured. It wasn't assault. You didn't hit the patient. So it's going to be a defamation of character. And B, defamation is hurting the reputation of a person by what you intentionally speak or write. 15, the resident has a red and irritated area on their elbow. The CNA should A, have the charge nurse check it as soon as possible, B, wash the elbow thoroughly with soap and water, C, apply lotion to the elbow, D, have another CNA decide what to do. Anytime there is a change in a patient's condition, including the skin, as a CNA, don't apply any soap, don't apply any lotion. You're going to A, we need you to notify the nurse. So the irritated area on the elbow may be the start of a pressure sore and should be checked by the charge nurse, okay? 16, a CNA is talking about her resident in the lunchroom. This is against the A, facilities, policies, and procedures, B, the resident's right to privacy, C, the resident's right to review their chart, or D, none of the above. And you all remember HIPAA. So this is a violation of the resident's right to privacy. Their information should never be discussed in a public area. Again, this violates the resident's right to privacy. 17, the CNA is giving personal care to a resident. She should A, leave the door open to the hallway, B, take the blanket and sheet completely off the resident to make the job easier, C, only uncover the part of the body where care is being given, or D, keep the privacy curtain open at all times. We're not going to leave the door open. We're not going to leave the curtain open. So we know it's not A and it's not D. Let's see what the correct answer is. The correct answer is C. You're going to protect the resident's privacy while giving care, and you're only going to uncover the part of the body that should be bathed. So you're not going to fully pull down the sheet. And plus, when you think about the sheets, they provide warmth and privacy, and our patients are sometimes cold. 18, the terminally ill resident refuses to eat and throws his tray across the floor. She is in what stage of dying? A, bargaining, B, anger, C, acceptance, or D, denial. And the correct answer is going to be B. When a resident is angry for any reason, you're going to encourage them to talk about their feelings. And so, hopefully you understand that that anger isn't directed towards you. This patient just had, a terminal illness recently diagnosed, and they're going to be upset. Okay, try to calm them down and let them discuss their feelings. And of course, notify the nurse as soon as you can do so. 19, it is time for Mr. Blake to have his temperature taken. Mr. Blake just smoked a cigarette. The CNA should A, take an oral temperature after waiting 15 to 20 minutes. B, Mr. Blake's temperature cannot be taken today because he smoked. C, smoking a cigarette makes no difference in an oral temperature reading. Or D, have Mr. Blake drink a glass of water to counteract the cigarette. Anytime someone has eaten, drank, or smoked, you want to do A. It could cause a misreading of the body temperature, so you want to wait about 15 to 20 minutes before you check the temperature to ensure an accurate reading. All right, how's everybody doing? Are we winners? All right, perfect. Number 20, upon entering a resident's room, you find her lying on the floor. What should you do first? A, call 911. B, run to the nurse's station for help. C, try to get the resident into bed. D, shake the resident and ask if she's okay. All right, and so I need there to be more, but the correct answer is going to be D, but while you're shaking that resident, be sure to scream out for help. Because if the resident isn't responding, you may want to be feeling for a pulse and starting CPR. Calling 911. If you're in the nursing home, usually your nurse or whoever comes to assist you can call 911, but we need someone on that chest performing CPR. Imagine if when the paramedics come and someone's in cardiac arrest and the paramedics document that CPR was never started. So if a person's on the ground, you want to be checking for responsiveness and calling for help from your nurse. And the answer is D. When you find someone lying on the floor, you must first assess to see if they're conscious or unconscious. If they're unconscious, call for help immediately. That's according to this question. My rule of thumb, if they're on the floor, you call for help immediately while you're tapping and shouting, checking for responsiveness. And if they're unresponsive, follow everything that you were taught in your BLS or your CPR class to make sure we get blood perfusing to that brain. Number 21, you're getting ready for a job interview. You should A, not wear perfume, B, not wear jeans and a t-shirt, C, not wear a lot of jewelry and makeup, D, all of the above. We know the answer to this one, whether we like it or not. The answer is going to be D. You're going to wear business attire and be very conservative with jewelry and makeup and the style of your hair when you're going to a job interview. And then especially if you're in the medical field, I do a nail check in all of our classes. If your fingernails are longer than the tips of your fingers, they're too long, all right? And so whether they're artificial or your real nails, cut them down because number one, when you're providing care, you can actually cut your resident's skin. And number two, there's germs that are harbored beneath those nails, which you can transfer to another patient and you can cause them to become ill. So when you're thinking about your attire, don't forget about your fingernails also. Number 22, Mr. Jackson has had a stroke. His left arm is very weak. When dressing, you should A, have Mr. Jackson put both arms in his shirt sleeves at the same time. But if one is weak, it's not going to happen, okay? B, not D, B, dress Mr. Jackson's left arm first, and the left arm was the weak arm. C, dress Mr. Jackson's right arm first. Or D, dress Mr. Jackson whatever way is easiest. And so if someone's left arm is weak and the right arm is strong, if you start dressing with the strong right arm first, usually when you get around, there's not enough room to get that left arm into the sleeve. So whenever someone has a weakened extremity, we usually dress the weak extremity first. And so the answer for this, again, it shouldn't be two Ds. The answer is going to be B as in boy. You're going to always dress the affected arm first to prevent injuries. 23, you're asked to assist Mrs. Johnson. What name should you call her? A, Mrs. Johnson, B, ma'am, C, Mrs. J, or D, Mrs. And it's going to be A. Always show respect for your resident by calling them their given name. And then what I'll normally do is I'll ask them how they want to be addressed, because sometimes they don't want to be called Mrs. Johnson. But for that first initial encounter, you call whatever's on the chart until you've been told otherwise. 24, your resident asks if she could have a moment to pray before her meal. You should A, let her know that her meal cannot wait. B, tell her she needs to eat before the meal becomes cold. C, provide her with a private moment to pray. Or D, ask her to wait to pray at bedtime. And we know our CNAs are super smart, super compassionate, and super caring. So the answer is C. You're going to show respect for a resident's spiritual needs. This is an important part of a CNA's job. So you're going to give her time to pray. 25, let's see if you remember this. The normal adult respiration rate is A, 5 to 15, B, 20 to 30, C, 15 to 25, or D as in dog, 12 to 20. What is the normal adult respiration rate? And if you said D, between 12 to 20 breaths per minute, you're absolutely correct. Great job. Right, 26, you all. Your resident is incontinent of urine. You should chart every time and you have to think about what incontinent means. For a lot of our CNA students, they think incontinence means retention. And it's not that the person's retaining urine. This person actually cannot control when they urinate, so they're wet. So you're a person who's wet with urine. You should chart every time A, urinates, B, wets the bed, C, takes in fluid, D, asks to go to the bathroom. All right, and so it's a little bit torn between A and B, but she could have wet the bed with water. So I want to be very specific. I'm going to chart every time A. When a resident is incontinent, they are unable to control their bladder. It's important to chart when they urinate, not just when the bed is wet, because you could have urinated 4 times, but the bed, because you didn't get there quickly enough, the bed has been wet for 4 hours. And so we want you to document every time the resident urinates. 27. An employer must offer a CNA a free vaccination for A, the flu, B, hepatitis C, B hepatitis C hepatitis B, or D AIDS. All right, and so this one is a little tricky because I know your facilities usually offer flu vaccines, but according to OSHA, employees must make hepatitis vaccinations available to workers who work in high-risk environments. So by law, especially if you work at a hospital or a nursing home, your facility will usually have you sign a paper saying that you either will approve to have a hepatitis B vaccine or that you decline it because it's contagious. 28. Which statement about canes is true? A cane can support all of the resident's weight. B, canes do not help with balance. C, canes are only used when a resident cannot support any weight. Or D, a quad cane has 4 rubber-tipped feet. And the correct answer is D. A cane is helpful to a resident with a weak leg. The cane helps support weight and helps with balance. And if you think about a quad cane, it literally has 4 prongs on the bottom, and those 4 prongs are evenly spaced. And so it's going to provide a wider stance or a wider base of support so your patient will be more stable. 29. How often are state inspections done in the facility? A, every 9 to 15 months, B, every month, C, every 6 months, or D, once a year. State inspections. And the correct answer is D. According to Medicare.gov, state survey agencies conduct nursing home inspections once a year, and of course more frequently if there's been a violation or a complaint. 30. The proper medical term for high blood pressure is cyanosis, hypertension, dysphagia, or D, hypotension. Okay, and I do want to just cover some prefixes for you. When you see the word cyan, C-Y-A-N, it usually means blue. When you see the prefix hyper, that means something is elevated or high. When you see the prefix dys, dis, that means something is painful. Right now, my throat doesn't hurt, but you can tell there's a change in my voice. And so, but if you heard a person who was speaking out normally, if you know what they sounded like previously, you would probably think, well, maybe they have dysphagia, maybe they may be difficult for them to swallow. Hypo, the P-O, think of someone who's poor. So when someone is hypo, their funds are low. All right, so hyper is high, hypo is low. So let's go back. The proper medical term for high blood pressure is, we know it's not A because A refers to turning blue. We know it's not C because C refers to pain because it says DYS. We know it's not D because hypo means low. So the correct term must be B, hypertension. And that's a term that we'll use if a person's been diagnosed with high blood pressures. That means their systolic blood pressure is greater than 140 and their diastolic is greater than 80. 31, when a resident is being admitted to a facility, which of the following should you observe and record? All right, so this is during the admission. A, the family history. B, any resident complaints. C, any broken skin, cuts, or bruises. D, the resident's I and O's. All right, so what's going to be really important for you to document when you're first encountering a resident? And that answer should be C. At admission, any marks that are observed on the resident's body should be recorded so that they later will not be mistaken for the resident being abused in the facility. And of course, your nurse should be documenting too, but as a CNA, your documentation is just as important. 32, when does restorative care begin? When does rehab begin, you all? A, as soon as possible. B, after a week of bed rest. C, when the resident decides to begin care. D, when the family decides to begin care. Well, some patients are non-compliant, so they're never going to decide to begin care. So we want you to be thinking about getting that person better as soon as possible. So usually discharge or rehabilitation starts on admission. Right? So A, it is important to begin restorative care as soon as possible to prevent any further complications. 33, and we're almost done. We have 70 questions total, and we're halfway there. 33, encouraging a resident to take part in their own personal care, such as eating and bathing, is A, against a resident's rights. B, necessary for rehabilitation. C, the family's responsibility. D, the charge nurse's responsibility. Why do you want to encourage this person to participate in their own care? B, rehabilitation should be part of patient care. You encourage them to do as much as they can, as often as they can. 34, when assisting a resident into a wheelchair, the nursing assistant's first step is to check A, the floor for clutter. B, if there is a gait belt. C, if the wheels are locked on the wheelchair. C, if the resident is cold. This is specifically referring to the wheelchair. So what should you do first to the wheelchair? C, before transferring the resident into a wheelchair, it is important to be sure that both of the wheels are locked. This will ensure a safe transfer. 35, a cold application is usually used to A, reduce swelling. B, help prevent shock. C, help increase blood flow. D, help cool down the area. All right, so a cold compress, when you think about RICE, like after a sports injury, that's rest, ice, compression, and elevation. Okay, and so when we're trying to reduce swelling, we will use a cold application. So the best answer is going to be A as in apple. A cold application can constrict blood vessels, all right? So it's going to decrease blood flow to that area. Therefore, it decreases swelling. Usually, we don't keep a cold compress on for longer than 10 minutes. And you always want to make sure that if you have a cold compress, you have it covered with something, because we don't want to put a cold gauze or whatever it is directly on the patient's skin, because we can actually cause frostbite or injury. So usually it's going to be some type of cold application that's inside of a baggie, some type of protective device, maybe, I won't say a washcloth, but if it's all that you have, a towel, you can use that also. And then you apply that to the resident's skin for no more than 10 minutes at a time. 36, when filling out an incident report, the CNA should A, document anything she heard about the incident. B, file the report in the resident's chart. C, only document objective information. D, only document subjective information. Right, so to know the difference between objective and subjective is really important in your documentation skills. Objective is real and factual. Subjective is how I felt about a situation. Okay, so when we're documenting, we want to do C. Objective information is factual information. On an incident report, only document factual information that you observed. For example, if you found a resident on the floor, the resident fell to the floor, you would document as a CNA that the resident was found on the floor, and then you could put that the patient states that she slipped to the floor because she didn't have her shoes on, or whatever the case may be. But what you saw would be actual objective, and what the patient states at this point would be the subjective. 37, which of these is considered a resident's right? A, private communication with mail and phone calls. B, having medical information kept confidential, C, privacy while receiving a physical exam, or D, all of the above. So which of those are residents right? And the correct answer is D. Providing privacy for a resident is important consideration at all times. So whether they're on the phone, they're talking to their doctor, they're taking a bath, protect their privacy. 38. Urination is also called A, wetting the bed, B, defecation, C, voiding, or D, bowel movement. And I'm going to help you out. Defecation is the act of having a bowel movement. So it's not B and it's not D. Urination is also called C, voiding. So urinary voiding is the process of removing urine from your body. And of course, when we go to the restroom, we're not wetting the bed. We void into a commode, into a toilet. So that's why the other answer option wasn't the best. 39. While dressing Mrs. Watson, she complains of a sore spot on her calf. You should A, finish dressing her and say nothing. B, stop dressing her and ask a charge nurse to check the spot. C, rub lotion on her calf. D, apply a cold compress to the spot. Her calf hurts, so that's a change in condition. All right, so it's going to be B. A sore or ache in the calf could indicate a blood clot, and the charge nurse should be informed immediately. So you would not be rubbing or massaging that area because you could dislodge the clot and it could travel. If it travels in the eye, it can cause blindness. It travels in the lung. We call it a pulmonary embolism. Travels in the brain, that's going to be a stroke. And of course, if it travels to the heart, they can have a heart attack. So we want to pretty much put that person in bed, they're on bed rest until we can figure out what's happening with their leg and why it's painful in their calf area. 40. The resident is using a walker. His elbows must be A, bent at a 45-degree angle, B, a 50-degree angle, C, a 90-degree angle, or D, a 15-degree angle. Whenever a resident is using a walker, their elbows are only slightly bent. So the one that's going to provide the least flexion is going to be D as in dog. A 15-degree angle creates the best balance between the resident and the walker. 41. When a resident is receiving force fluid treatments, you should offer residents every hour. Provide only high protein fluids. C, provide more than 1,000 cc's of fluid per shift. Or D, none of the above. So force fluids, this person's dehydrated. What should you do? Yep, and I already gave you the answer. A, fluids need to be encouraged on a regular basis throughout the day. So you want to be asking them about, encourage their water intake, their fluid intake at least once per hour. And then you always want to follow the documented care plan for the resident. So when it said like give 1,000 cc's or whatever, that may be a little too much, especially if the person also has IV fluids going. So you as a CNA, your job is to keep the water pitcher filled. And every time you go in, just encourage that person to drink some more water or to give them maybe something that they would like to drink. Be careful with caffeinated drinks because caffeinated drinks have diuretic tendencies, which means that if you give me a cup of coffee, it's going to make me void. It's going to make me urinate. So I'm going to be pulling out the fluid that you're trying to replace. So usually it's not going to be any caffeine. It can be maybe some juices or it can be just regular water. 42. If a resident has not had a bowel movement in several days, he may complain of A, nausea, B, decreased appetite, C, abdominal cramps, or D, all of the above. All right. So if your person is constipated, what are they going to complain of? D, all of the above. It's important to always document and report all of a resident's symptoms relating to any condition. So if someone is constipated, they haven't been having a bowel movement, as a CNA, your job is to increase fluids, increase activity, and check with your nurse first. You want to see if maybe you can get some prune juice or some prunes. And if you give them a whole bunch of fiber without fluids, fiber is going to bulk up the stool, but it's just going to constipate them more. So you just can't give them a whole bunch of total with milk. You need to give them some total with milk and then also some water. And hopefully that's going to help move the bowels. 43. In what manner should a CNA report care given to a resident? A, by entering it into the resident's chart. B, by telling the charge nurse. C, by reporting to the next CNA on duty. D, by reporting to the DON, that's the director of nursing, so that's the person who's over the entire unit. How should you report care given to a resident? Legally, we need to write it down. If it is not documented, we have no proof that it's been done. So A, all care given to a resident must be documented in the resident's chart. 44, a resident that is mentally ill is likely to A, live in their own fantasy world, B, have feelings of fear and anxiety, C, believe they are someone other than themselves, or D, all of the above. When someone has mental illness, it's going to be D. Mentally ill residents may often have irrational feelings and concerns regarding their well-being. And so you still want to treat them with respect, and we still want to listen to them, but you also, want to fully understand that they sometimes are in their own world, and they can become agitated or anxious very quickly when we try to reorient them. 45, a resident has a decreased appetite. He should be offered A, a bland diet, B, high-protein milkshakes, C, dietary supplements, or D, only the foods that he likes. Right? And so when someone has a decreased appetite, we want to order or at least offer dietary supplements because they contain vitamins and minerals to help maintain good health. And so usually these are very specific to the patient's needs. If they have a respiratory condition, there's a dietary supplement called Respiror. If they're a diabetic, we don't give them Boost because Boost contains sugar. We give them the diabetic version, which is called Ensure. So it's very important that if you notice your patient isn't eating, that you work with the nurse who will then contact the doctor, and we get the dietary supplement that is specific to that patient's needs. If we're not careful, we can be giving somebody who has kidney failure a supplement that has potassium, which means that they would have to go to dialysis more frequently, and we could be causing a major medical issue. 46, which of the following is considered caring behavior to the resident? A, working fast and efficient. B, helping the resident with patience and understanding. C, only helping when asked. D, coming to work on time. All right, so caring behavior towards the resident. B, a CNA's job is to observe what the resident may need, so we need you to be proactive and be available when the resident needs help. A CNA must be patient when helping the resident. 47, you've been asked to shave Mr. Jackson's face. It is important to A, use Mr. Jackson's approved shaving products. B, shave the cheeks with an upward stroke. C, use betadine, or it should be betadine, or Nix. And then D, a CNA is not allowed to shave anyone. So when you're shaving someone's face, think about the different skin types and skin conditions and the coarseness or the thickness of the hair follicles. The answer is going to be A. Always use the resident's personal care products unless specifically directed not to by the charge nurse. 48. One of the best ways to help prevent a decubitus ulcer or bed sore is to A, apply lotion to any red spots. B, change the bed linens every day. C, reposition the resident every 2 hours. Or D, encourage the resident to drink plenty of water. How do you as a CNA prevent a bed sore? And if you said C, repositioning, you're absolutely correct. Very good. All right, and then don't forget, if you have not already subscribed to our channel, go ahead and do so. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy, and this is what I do all day, every day. I help future CNAs, future nurses get to the next level, and so we usually have about 2 videos that we post per week specific for CNAs, and we just love to have you as part of our family. All right, so 49, Mr. Blake is confined to a bed. You are assigned to Mr. Blake. You are assigned to help Mr. Blake with his lunch. What position should Mr. Blake be in before he eats? A, Sims position. Sims is usually a sideline position that we'll use whenever we're going to be giving a patient an enema. And as a CNA, you may not be giving medication, but when I say, hey, Leslie, I got to give Mr. Blake a cinema, an enema. You want to get him on his side, put a whole bunch of pads under him. And if you leave him on his left side, it's going to be easier whenever I give the enema. It's going to be able to travel further, through the colon. So Sims, think of the enema position. Even though you don't give the medication, you do help the nurses with the repositioning. B, reverse Trendelenburg position. So I know what Trendelenburg is, so reverse is the opposite way. That just sounds strange. We know that's not the answer. C, a lateral position. Lateral is side lying. Are you going to put someone on their side before they eat? And then D is Fowlers. When you think of Fowlers, think of somebody who's sitting up. They may be semi-reclined, but usually Fowlers is anywhere from 30 up to 90 degrees. And we encourage our CNAs here at Florida Training Academy to get that patient all the way up so that they're less likely to aspirate. So the best answer is D. All right, and here it says 45-degree angle or higher, but remember, you get to help, you get to control. If that person can't sit all the way up, use pillows to help them sit up because it'll help them prevent aspiration. 50, the requirements for nurse aides in long-term care facilities are to complete a nurse aide educational course and a competency evaluation. These requirements were set by A, the FDA, B, OBRA, C, the CDC, and then D, OSHA. And so we know the ones who set the rules for the nursing homes, the long-term care facilities, was B. All right, it was the Omnibus Budget and I think it was Reform Act. I do apologize for said that incorrectly before. I think before I put Reconciliation Act. 51, Mrs. Watson sprained her ankle. A cold application is being applied. It is important to observe the resident for possible signs of A, fatigue, B, dizziness, C, cyanosis, or D, redness. All right, so if we keep a cold compress on the skin for too long, what do you think is going to happen? And it's going to be C. Cyanosis is a sign of poor circulation and could lead to tissue death. Stop treatment at once and report the change to the charge nurse. 52. The best way to keep a resident's personal information confidential is to A, keep a resident's medical information private, B, only share information with those involved with the resident, C, never share a resident's medical condition with your friends, or D, all of the above. All right, and I know that you're smart, and we know it's all of the above. Only those involved in the resident's care are allowed access to the resident's medical and personal information. 53, the term up ad lib means the resident is is independent with balanced periods of rest and activity. B, is assigned to complete bed rest. C, must not perform any ADLs, activities of daily living alone. And then D, must eat all of their meals in their bed. So when someone is up ad lib, they're independent, all right, but you do want to monitor them and offer assistance whenever needed. So A, this is an activity order that suggests the resident performs their ADLs. And what does ADLs mean? Activities of daily living independently with periods of rest as needed. 54, we get to do some math. The resident is given a glass that holds 320 cc's. The resident drinks 1/4 or 1/4 of the glass. What amount will the CNA record? All right, so we have to divide 320 by 4. And that answer is going to be C. It's going to be 80 cc's. 55. The CNA finds a roach in a resident's room. The CNA should A, place a roach trap in the room. B, report it to housekeeping immediately. C, ignore the roach. Everyone has them. D, tell the resident never to walk barefoot. So if you see a bug in your resident's room, you want to notify housekeeping because insects carry diseases and it is unacceptable for insects to be found in a healthcare setting. 56, Mr. Jackson complains of numbness on his left side. His grip is weak and he is slurring his words. You should A, check back with the resident in an hour to see if his condition has changed. B, call 911. C, notify the charge nurse immediately. This may be a sign of a CVA, which is cerebral vascular accident or stroke. And D, notify the charge nurse when you have time. Anytime there is a change in a resident's condition, your answer is always going to be to notify that nurse. So the answer is C. The CNA must always report to the charge nurse any unusual signs or symptoms that she may observe as soon as possible. 57. When giving oral care to a resident, the CNA should always A. Use dental floss, B. Remove oxygen before brushing, C. Wear gloves, or D. All of the above. So when you're performing oral care, what do you have to do? The correct answer is C. All right, let's talk about that, removing the oxygen. Removing oxygen is not necessary when brushing the teeth. Remember, sometimes the oxygen is in the nose, or you could have like a simple mask on. You could either lift the mask or leave the nasal prongs in place. However, the CNA must wear gloves when providing mouth care to reduce the risk of contamination. 58. Mr. Jackson is having trouble swallowing. He may be suffering from incontinence, insomnia, dysphagia, or influenza. Right? So when someone is having trouble swallowing, we call that dysphagia. So dysphagia or dysphagia is the medical term for swallowing difficulties. Some people with dysphagia have problems swallowing certain foods or liquids, while others can't swallow at all. And that's usually when we'll start modifying their diet, or we may end up making them NPO. 59. The CNA is shaving Mr. Jones and accidentally nicks him. What should she do? A. Report the incident to the charge nurse. B. Ignore the nick and continue shaving. C. Call a doctor. D. Put a Band-Aid on the nick. And this is a change in the patient's skin condition. So we're going to report that injury to the charge nurse right away. And maybe we don't need to be shaving him with a regular razor. We need to encourage that family member to bring in an electric razor. 60. Mr. Peters is going to the dentist in the morning. He states he is not anxious about the visit, but he is pacing and unable to stay calm. The CNA should A. Insist that he goes back into his room and calm down. B. Ask other residents and staff members to calm him down. C. Realize by Mr. Peters' body language that he is agitated about the visit and ask the charge nurse to speak with him. D. Call Mr. Peters' family and ask them to speak with him. All right, so we want to be proactive. We don't want Mr. Peters getting to the dental office and then they can't even perform this procedure because of his anxiety. So we want to let that nurse know about it. So the answer is C. Regardless of what a resident may say, their body language can convey the truth about their feelings. Never ignore a resident who appears upset. All right, we only have 9 more to go. Number 61, everybody. Mr. Johnson's son has passed away recently. She continues to talk about him and waits for him to visit each day. She is experiencing A. Acceptance, B. Anger, C. Depression, or D. Denial. Okay, and the answer is D. Although the resident may be experiencing such things as anger and depression over the death of her son, she is in denial if she's still waiting for him to visit each day. So you do want to allow them to express their emotions, to talk about their son. And if you want to, you can speak with the nurse because we do have case management, we have counselors, and she may need to be speaking to someone, maybe like a psychiatrist. 62. When muscles atrophy, they become A. Smaller, B. Softer, C. Larger, or D. Harder. Muscle atrophy. And the answer is A. Muscle atrophy or wasting means the muscle is getting smaller. To prevent this, a resident will be prescribed range of motion exercises to help keep the muscles from weakening. Remember, if you don't use it, you lose it. 63. Huntington's disease can be recognized by A. Aggressive behavior, B. Strange body movements, C. Heavy perspiration, or D. Fatigue. And I have a picture so that you'll be able to recognize Huntington or a person with Huntington's disease. And because of the neurologic concerns, and they're going to have muscle loss, and so they're not going to be able to control their body movements. So the most common sign of Huntington's disease is the inability to control one's body movements. And here we have a resident who has the disease, and he's shown in the picture, and looks like he's either in a geriatric chair or a wheelchair. 64. Before giving care to a resident, you should A. Put on your gloves, B. Get out all the supplies you need, C. Change the resident's sheets, D. Check the identification of the resident. All right, so which is going to be the safest? What do you need to do first? And the answer is D. You must always check the identification of the resident before giving care. If you give care to the wrong resident, that is your responsibility. So we want to make sure that we're giving the right care to the right person at the right time. 65. Mr. Jones is looking sad and sitting in the corner all alone. You should A, and it's Mrs. Jones, excuse me, leave her alone and don't bother her. B, tell her she must participate in activities. C, sit down with her and ask what is wrong. D, assume she is sad because her children are not visiting today. So if you see somebody sitting all alone and you are a compassionate CNA, you're going to see. You're never going to assume you know what is wrong with the resident. You're going to stop, take time, and ask the resident what you can do to help. 66. A common sign that death may be approaching is A, decreasing body functions, B, severe body pain, C, severe fatigue, or D, unresponsiveness. All right, so death may be approaching whenever someone is admitted to hospice. Usually, they're not going to be as arousable. Well, let me backtrack. In-stage hospice, because you have patients who are still ambulatory who may be under hospice care, but when they're in stage, usually they're not going to be as alert. They're not going to be hungry, so they won't be wanting to eat. They're going to have less urine production, and they're probably not going to have a bowel movement. So their body functions start decreasing. So as I already told you, the answer is going to be A. When death is near, circulation slows and normal body functions decrease. And our goal is to provide palliative care, and that's to keep them comfortable during that time. 67. Which is a correct statement about fire extinguishers? A, never use a fire extinguisher in a closed area. B, CNAs are not required to use fire extinguishers. C, certain fires should only be used on certain type of fires. Certain fire extinguishers should only be used on certain types of fires. And then D, all fire extinguishers are the same. Okay, we know D is not the answer. It is going to be C. Right? And so all fire extinguishers are not the same. You will be trained in your facility on how to use a fire extinguisher and which fire extinguisher ought to be used on which type of fires. And remember to pass. So pass stands for pull. You're going to pull the pin. You're going to aim towards the base of the fire. The first S is to squeeze. You want to squeeze the nozzle. And the second S is to sweep side to side at the base of the actual fire. So what does pass stand for? Pull, aim, squeeze, and sweep side to side at the top of the fire? No, at the base of the fire. Very good. All right, 68. When you enter Mr. Blake's room, you notice a CNA pushing Mr. Blake onto the bed. You should A, keep it to yourself. B, report it immediately to the charge nurse. C, tell the CNA not to push Mr. Blake. Or D, check on Mr. Blake later to see if he's okay. And we are mandatory reporters, so the answer is going to be B. You need to report that to the charge nurse. So any incident of resident abuse must be reported to your supervisor. 69. You're helping your resident learn to use a walker. It is important that you, A, let him learn on his own to promote independence. B, only help him if you have time. C, pat the floor around him in case he falls. D, stand behind him and use a gait belt. All right, so which sounds the safest? And the safest option is D. You're going to stand behind the resident while holding the transfer belt. That will promote safety for you and the resident in the learning process. All right. And then lastly, number 70, urinary retention refers to A, incontinence. And I already told you, incontinence doesn't mean retaining. Incontinence means they can't control it, so they're actually wet. So urinary retention is not incontinence. All right, so B would be normal amount of urine output. C would be the inability to urinate. Or D, urinary retention refers to a large amount of urine. And the correct answer for 70, when someone's retaining, right? So if it was fecal retention, we call that constipation. This is urinary retention, so it must be C. The person cannot urinate, all right? And so if a resident is retaining urine or unable to urinate, it should report it to the charge nurse as soon as possible. And some of the symptoms or signs that your patient may be complaining of could be like lower abdominal pain, or you could actually see like bladder distension. So everybody, guess what? We have completed 70 practice CNA questions. We have playlists with questions, with skills. If you need help with CPR, we also train some of the best American Heart Association CPR, BLS, ACLS, and PALS instructors in Florida and also around the world. So we do hope that if you have any questions, just leave us a few comments below. And thank you all for bearing with my voice. But I'm just so happy to, be 3 days after surgery, able to go back and do what I love, and that's train my baby. So you all have a blessed day, and I'll see you all in the next video. Bye-bye. Hello, everybody, and welcome. My name is Eunice Mathis. I'm a registered nurse and also the owner of Florida Training Academy. In today's video, we're going to be reviewing 60 multiple choice practice questions to help you pass the Certified Nursing Assistant Examination. We call it for short the CNA Exam. In Jacksonville, Florida, we offer CNA Exam prep courses and also CNA train-the-trainer courses for nurses. So whether you're a student who's looking to get a entry into the medical field, or if you're a nurse who's looking to do something else with their career, and also start training others, we're definitely here to assist you. If you look at our playlist, you're going to see videos on CPR, CNA skills, and also CNA practice questions. If you follow us, go ahead and subscribe to our channel. Within the next 2 to 3 days, we should have new clinical videos, skills videos being posted. And so that way you can always be learning and practicing as you prepare to take your CNA exam. Our website is fltraining.com. That's fltraining.com. And let's start with question number 1. Question number 1, which of the following should you observe and record when admitting a patient? A, the color of the stool and the amount of urine voided. B, how much the patient has eaten or drunk. C, bruises, marks, rashes, or broken skin. D, requests the patient makes. All right, so if this is your first encounter with this person, unless there's something grossly abnormal with the stool or the urine, that's not something I report to the nurse right away. But as a healthcare provider, we are mandatory reporters. And so if you see bruises or marks, that could be a sign of abuse. You want to make sure that you actually report that to the nurse. And so I think that for number 1, the correct answer is going to be C. And let's see what this system says. All right, it says the correct answer is C. Failure to notice bruises or marks on the skin on admission may later cause someone to believe that you were involved in abuse. All right. Question number 2. When responding to a patient on the intercom, you should A, ask the patient's name. B, say, may I help you? D, give your name and position. D, say the nurse will answer your call. All right, so a patient's calling you, you have the intercom. I'm going to say that you're going to ask, may I help you? I'm not sure though, so don't judge me too harshly. Let's see. I was incorrect. When responding to a patient on the intercom, you should give your name and position. Well, I guess a lot of us do that incorrectly. So far, everybody, I've missed one question. 3, which of the following things should you do to familiarize a new patient to his or her surroundings? A, show the patient where the call bell is and how to work it. B, tell the patient not to operate the TV. C, ask visitors to leave the room while you finish admitting the patient. D, raise the side rails of the bed and raise the bed to a high position. Well, we're not going to be raising the bed to a high position just to be showing someone their surroundings because that would be unsafe. I think the best answer for this question is going to be A, because I'm considering the patient's safety. And if I'm familiarizing them with their room and their surroundings, I definitely want them to know how to operate the call bell. Let's see if I'm correct. And the correct answer is A. You should never leave a new admit until the patient knows how to call for help. Question number 4. When arranging a patient's room, you should do all of the following except check signal cords, fix the back and knee rest as directed, administer medications, check lighting. So this requires you to know the role of the CNA. And CNAs do not administer medications. Nurses, respiratory therapists, pharmacists, and doctors administer medication. And so I think that the exception to the rule would be C. You can do everything except for administer medications. And that is correct. Nursing assistants are never allowed to give medications. There are some medication aid or medication tech courses that you can take once you're certified as a CNA. However, I need you to remember that when you're taking the exam, you're not at that level yet. You've not taken these additional courses, and you cannot assist with medications. If you touch a pill, you're stepping outside of your scope of practice. Question number 5. When assisting a patient in and out of bed, you should always employ body mechanic techniques. B, get another person to help. C, put the patient's feet out first and then lift the back up. D, put shoes on the patient because the patient may slip. When you're assisting someone out of bed, you should always, I'm going to say D. Yes, we want you to use good body mechanics, but we also need to make sure that the patient doesn't fall. Oh, this is a tricky one. If I get it wrong, don't judge me too harshly. I got it wrong. I don't like this test, you all, but we're going to continue on. It says you should always use good body mechanics when moving patients. Yeah, I'm going to think about that one. 6, when you wash your hands, when should you wash your hands? A, when you notice that they look or feel dirty. B, when the head nurse tells you to. C, at least twice a day. D, before and after patient contact. And the correct answer for this is going to be D as in dog, before and after patient contact. Question number 7. Which of the following is the correct procedure for serving a meal to a patient who must be fed? A, serve the tray along with all the other trays and then come back to feed the patient. B, bring the tray to the patient last. Feed after you have served all the other patients. C, bring the tray into the room when you are ready to feed the patient. And then D, have the kitchen hold the tray for 1 hour. I don't want to increase my patient's hunger or their anticipation to eat, so I'm probably not going to bring that tray into the room until I am ready to feed him or her. So I think the answer is C, but I've been wrong twice so far, so let's see what the answer is. All right, and so this one also confirms you should not bring the tray into the room until you have time to feed the patient. 8, a newly admitted patient has dirty fingernails. When given the patient a bath, you should first soak the nails, trim the nails, apply extra lotion, clean the nails with a metal file. Well, I can tell you now, we're not using metal on our patients. That would be a safety hazard. So I'm going to say that we're going to soak the nails so that we can loosen up some of the residue that's beneath their nails. I think the answer is A. All right, and so the correct answer is A. It says that soaking the nails first will make them easier to clean. Question number 9. When you move a patient on a stretcher, you should stand at the patient's right side, left side, head, or feet. And I want you to think about it. If you've ever seen a stretcher before, where are the handles on the stretcher? It's always at the head. So I'm going to say that the answer to number 9 is C. And that is correct. Always control a stretcher from the head in case you lose control of it. 10. The most serious problem that wrinkles in the bedclothes can cause is restlessness, sleeplessness, decubitus ulcers, or bleeding and shock. Whenever you leave that extra material beneath your patient, whether it's their gown or pads, that wrinkle can cause an indentation. Think about when you have socks on for too long and you get those little creases. Same thing can happen to your patient's skin. And because their skin is frail, one of those creases can actually open and we have the start of a sore. So I'm going to say the answer is going to be C as in cat. All right, and great. This particular response states that the most serious problems that wrinkles in the bedclothes can cause are decubitus ulcers or decubiti. Question 11. When making a bed, you can save steps and time if you A, assemble all needed linen before starting to make the bed. B, tuck in the bottom linen and top linen at the foot of the bed before going to the head of the bed. C, only use fitted sheets. D, ask for help from the head nurse. I'm sure she's busy with other duties. And so in order to save some time and some steps, we need you to collect all your equipment first, have everything you need. And I think the answer to number 11 is A. And that is correct. You want to gather all supplies first in order to save time. 12. One important way to reduce the risk of decubitus ulcers, and that's like pressure injuries from a person laying in place too long, is to A, keep the patient in bed, and B, force fluids every 2 hours. D, change positions every 2 hours. D, all of the above. And so even if you have a patient who is bedridden, we don't keep them in bed all day. We use like a Hoyer lift or a crane in order to reposition them and maybe get them up into a geriatric chair. So I think the answer for number 12 is C as in cat. And yay, I'm winning again. Whew, it was hard. I missed 2 so far. Changing a patient's position every 2 hours prevents bed sores. 13, you are told to put a patient in Fowler's position. Before changing the position of the patient's bed, you should A, open the window, B, explain the procedure to the patient, C, check with the patient's family, D, remake the bed. And so when you think of a Fowler's position, flat is supine. When someone is laying on their spine, they're in a supine position. When you think of Fowler's position, think of a reclining position that would be semi-Fowler's, or high Fowler's if a patient is short of breath or they're vomiting. You don't want them vomiting when they're laying back. You're going to put them in a high Fowler's position. Before I change someone's position, I want to explain the procedure to them and let them know the reason why I am doing so. So I think the answer to number 13 is B as in boy. And the response states you should always explain procedures first. So that makes B the correct answer. 14, you touch the inside of the sink while rinsing soap off your hands. You should A, allow the water to run over your hands for 2 minutes. B, dry your hands and turn off the faucet with the paper towel. C, repeat the wash from the beginning. D, none of the above. If you contaminated your hands, we need you to go back and cleanse your hands. So I think the answer is C. Right? And the response states you have contaminated your hands and must start over again. Question 15, as a safety measure, when you give mouth care to an unconscious patient, you should position the patient A, on his or her back, B, in a semi-Fowler's position, C, with the head turned to the side, and D, in the supine position. Remember, for the supine position, if you take the U out, they're laying on their spine, which means they're laying flat, and that's guaranteed to cause your patient to aspirate. So we know D is not the correct answer. If someone is unconscious, more than likely they do not have a gag reflex. So even putting the smallest amount of liquid in their mouth could actually cause that liquid to travel back into their airway and they can aspirate. So the answer is also not B. The correct response is going to be C. Whenever you turn that patient to his or her side or turn their head to the side, it's going to allow the secretions to accumulate in the jaw area. And if you have a Yonker or a suction wand, you can go in there and remove those excess secretions safely. So the answer to number 15 should be C as in cat. All right, and awesome. Turn the head to the side will assist with the drainage out of the mouth. 16, when you obtain a clean catch urine specimen, you should wash the patient's hands. Or B, use clean techniques. C, use sterile techniques. D, perform the procedure in the bathroom. It doesn't matter. You're just catching urine. So you can catch urine in a bedpan. So they don't have to be in the bathroom. So it would not be D. A clean catch specimen is not a sterile specimen. And so since you're the one performing the skill, you're going to have gloves on and you would have washed your hands. You would not have to wash the resident's or the patient's hands before you start a clean catch specimen. So the answer for this one is going to be B as in boy. A clean catch urine specimen does not require sterile technique. Question 17, Mr. Rourke, a newly admitted conscious patient has been put to bed. Before leaving him alone, you should A, ask if he is hungry, B, inspect his skin, C, complete the listing of his clothing and valuables, D, make sure he knows how to use the call light. Of course, C is correct. Of course, B is correct, but you're about to put him to bed. And if he is newly admitted, we're going to think of safety first. I'm going to say the answer is D. Make sure he knows how to use his call light. Okay. And we also got that one correct. We're doing good, team. Great job. 18, when lifting a heavy object, you should bend at the waist, keeping your legs straight. B, at the waist, rounding your shoulders. C, at the knees, keeping your back straight. D, you should bend at the knees and the waist. Oh my, that's a lot. I think the answer is going to be C. You want to keep that back straight and use your leg muscles. So we're going to see if C is right. When lifting a heavy object, keep your back straight. Keeping your back straight forces you to use your strong leg muscles. Great job. 19, we already covered this one. Wrinkles in the bedclothes can A, overheat the patient, B, irritate the patient's skin, C, result in torn sheets, D, restrict the patient's activity. What do those wrinkles do? I don't like the word irritate here, but that's the word they chose. So I'm going to say the answer is B. All right. And the irritation can lead to bed sores. 20, when shaving a resident, you should wet the patient's face, apply aftershave lotion when done. C, give the patient a mirror when done. D, all of the above. I think the answer is all of the above. And that is correct too. 21, when cleaning a patient's dentures at the sink, the reason to either line the emesis basin with a paper towel or fill the sink with water is to A, prevent contamination of the dentures, B, hide the dentures from view, C, guard against breaking the dentures, D, protect the basin from scratches. The dentures are more expensive than the basin, so I know that D isn't the correct answer. And whenever you're thinking about those dentures, when they're coming out of someone's mouth, they have saliva, it could have food particles. And even though we have gloves on, it's not a sight that you really want to see. And sometimes because we don't hold the dentures tight enough, the dentures can actually drop, hit the bottom of the sink, and they can actually be damaged. And so in order to prevent that damage, you want to have something in the bottom of your sink and or have something in the bottom of the sink and fill it with a little bit of water. That way, if they drop, it hits the water splashes instead of the denture breaking. And so I'm going to say the answer is C as in cat. Woohoo! The purpose of this procedure is to prevent breakage. Yes. 22, when assisting a resident with eating, one of the first things you should do is cut the food into large bite-sized pieces. That is an oxymoron. Large bite size. So it's not A. B, wash your hands and the patient's hands. C, butter the patient's bread. D, provide the patient with privacy. If you think about some of the assisted living facilities, they actually eat in a group or a community setting. So you really can't provide privacy. When you're taking a CNA exam, do not think that you're just in one location, such as a hospital where everybody has individual rooms. You're taking care of an adult population, whether that's a group home, assisted living facility, nursing home, or hospital, and also home care. And so I think the best response for this one is you don't want to contaminate the food. So you're going to wash your hands, and also you're going to wash the resident's or the patient's hands. The answer should be B as in boy. And that is correct. We're going to remember infection control. 23, a patient has a new cast on his right arm. While caring for him, you should observe for a pulse over the cast, color and hardness of the cast, the warmth and color of the fingers, sign of crumbling at the cast end. All right, so this one is asking you, how do you determine if the person has sufficient circulation once they have a new cast placed? Sometimes the actual arm, or especially due to the injury, that extremity could swell. And if it swells too much, plus it has a tight cast on, we can actually cut off circulation. So going above the cast isn't as important as looking below the cast. And you're going to be checking the capillary refill and checking to see if that hand is swollen. So I'm going to say the correct answer is C as in cat. C as in cat. And yes, a new cast may cut off circulation. So C reminds you to check for circulatory impairment. And you're like, well, that's the nurse's role. No, you also are in the room. And if you see the hand is pale, that's something that you can notify the nurse of also. We work as a team, and some of these nursing homes right now, especially because we're short-staffed, there may be one CNA to 15 patients. And so hopefully if there is a floor that has, or a hospital that has 30 residents, hopefully you have 1 or 2 nurses, but your nurses are busy. They may miss something. At the end of the day, we all work together in order to keep our patients safe. So yes, if you notice it, please notify your nurse. 24, encouraging a patient to take part in activities of daily living. We call that ADLs, such as bathing, combing hair, and feeding is A, done only when time permits, B, the family's responsibility, C, necessary for rehabilitation, D, a violation of patient's rights. What I want you to think of is from the time of admission, our goal is to prepare that patient for discharge. We try to keep them as independent as possible for as long as possible. And so you want them moving, combing their hair, even if they have an affected side from a stroke. The side that they can move, you have them participate in their care because it is necessary for rehabilitation. And let's see if we are correct here with the response being C. And yes, we are. Rehabilitation should always be a part of the care plan. So allow your patients to assist, even if it will take you longer to complete a skill. 25, in caring for a confused elderly man, you should remember to keep the bed rails up except for when you are at the bedside. B, close the door to the room so he does not disturb other patients. C, keep the room dark and quiet at all times to keep the patient from becoming upset. D, remind him each morning to shower and shave independently. Recipe for disaster. We're not going to let a confused person shave independently. We're not going to keep a confused person in a dark room. That is definitely neglect. Okay. I'm not going to close him off so he does not disturb other residents. This one says keep the bed rails up except for when you are at the bedside. I'm going to choose A because that's the only option, but knowing that in some of your facilities, they are restraint free, which means they could be bed rail free, not hospitals. We're talking about assisted living facilities and Alzheimer's units. They have beds that go all the way down to the floor. So for this answer, this is the best response, A. But in the real world, based on where you work, you may not be putting all those rails up because there may not be rails on the bed. And research shows that bed rails do not prevent falls. If a person is confused and they want to fall, they simply climb over the rail and then they have a fall from a higher elevation and cause more injury. If you don't believe me, research it yourself. So I'm going to say that 25 is A as an apple. And they even put it there, make sure to follow the agency policy because it just depends on where you work. Oh my God, I do not know this answer. The water temperature for a tub bath is 98 degrees Fahrenheit, or B, 105 degrees Fahrenheit, C, 115 degrees Fahrenheit. Well, I definitely know it's not D, 212 degrees Fahrenheit. Oh my, I'm going to go with the safest option. What do you think? It's either A or B. We usually don't go by thermometers whenever we're giving a person a bath, and we rarely ever give our patients tub baths. So I'm definitely at a loss with this one. I'm going to think it is A. We usually let the person put their finger in the water, their toe in the water, and if the water is good, then you can allow them to proceed. Oh my. Are you smarter than a nurse? Let's see what answer you have. I say A. I was wrong, you all. That means I missed 3 so far. The water temperature for a tub bath is 105 degrees Fahrenheit. Fortunately, unless you're like in home care, you're not going to be giving your patient tub baths. Usually they all take showers. 27, when given a complete bed bath, you should A, not wash the patient's genitals because the patient will feel embarrassed. B, use the same washcloth throughout the bath to save you from extra trips. Note, because our CNAs know to prepare for the bath and have extra supplies. C, keep the patient covered as much as possible. I think that's a great option. D, position yourself on one side of the bed and stay there. No, because when you're reaching over the patient, you can contaminate yourself. And so I think the correct answer is going to be C. Let us see. Woohoo! The other choices are wrong because of proper care techniques or body mechanics. And I want to say because of improper care techniques or body mechanics. 28, when assisting Mr. Cohen in learning to use a walker, you should A, stand behind him and use a transfer belt. B, put padding all the way around him, around the top rim. Put padding all the way around the top rim. I guess you're speaking of the actual walker. No. C, let him walk by himself so he gains independence. No. D, let him practice using the walker on the day he is discharged. No, remember, discharge starts upon admission. And so when physical therapy comes in, does the evaluation and says this person needs a walker, every time we get him out of bed, we're going to allow him to use the walker. I think that the use of the transfer belt makes A, the best option, because the transfer belt allows you to hold on to the resident, but allows him or her to use that walker, and you're just supporting them by holding on to that belt. So let's see if we're correct. 28 is A. Woohoo! Standing behind him and using a transfer belt protects both the client and the nurse aide. 29, before assisting a patient into a wheelchair, check to see if the A, patient is adequately covered, B, floor is slippery, C, door to the room is closed, D, wheels of the chair are locked. Because they're specifically talking about the wheelchair, hopefully the floor is not slippery, I'm going to focus on the wheelchair. That was their keyword, wheelchair. And so I'm going to choose the answer D, because you don't want to transfer somebody into the wheelchair if the chair is unlocked, because the chair is going to move and your person's going to fall on the floor, whether the floor is slippery or not. So let's see if the answer is D. And it is. Before assisting a patient into the wheelchair, check to see if the wheels of the chair are locked. 30. When giving an unconscious patient a bath, it is important to A, give passive range of motion to all joints. B, let the team leader exercise the patient's joints. C, call the physical therapist to exercise the patient afterwards. D, exercise the patient only if the doctor has ordered it. Anytime you're in a patient, you want them moving. In patient's room, you want them moving. And so if you are bathing an unconscious person, when you're lifting their arms to bathe their armpits or what have you, you want to be providing that passive range of motion so that we can keep those joints flexible. We don't want them to become stiff. If they become stiff, they get contracted, and then it's hard to move that patient. So the answer should be A as in apple. Let us see. Yes, passive range of motion, or ROM, should always be given with the bath on an unconscious patient. 31. We're almost done, everybody. When reporting your patient's condition to your team leader, you should report immediately. A, a rash that appears suddenly. B, warm, dry, and pink skin. C, rough skin on the feet. D, scarred skin. Let's talk about prioritization in emergencies. If the skin is scarred, is that a recent injury? No, that's something that happened a while ago. You would not notify the nurse about that immediately. I hate to tell you, I live in Florida and a lot of people have on sandals and a lot of people have rough skin on their feet. And so that's not something I report immediately. These are actual normal findings depending on the complexion of your patient. Warm, dry, and pink skin. If that's normal for your patient's skin or race, that's not something you're going to notify the nurse about. This is a sign of anaphylaxis. This is a sign of a rash, and your person could immediately start having breathing difficulty. So you want to notify your nurse of this immediately. Maybe the nurse had just given a new medication and the patient did not know they were allergic to it. And yes, the answer is A. Of the answers listed, only A is an acute change. Acute meaning recent. 23. When shaving a male patient's face, you should apply shaving cream sparingly, use upward strokes when shaving the cheeks, apply betadine to any nicks. We don't even use betadine anymore. D, none of the above. Because this is the first question that's given the option none of the above, I'm going to choose none of the above. I have never shaved a person with a razor. Thank God they have electric shavers now. Upward strokes when shaving the cheeks. Nope, downward. So I'm going to say D as in dog. Oh Lord, if I miss this one, that means I've missed 4. Whew. Process of elimination. 33. A decubitus ulcer is A, stomach ulcer, B, pressure sore, D, duodenal ulcer. That's like when someone has like a GI bleed, or D, sore on the toe. And you all should know the answer to this because we've already stated it. A decubitus ulcer is B, a pressure sore. All right. Also referred to as bed sores. 34. You are assigned to assist Mrs. Kelly with her lunch. She is on bed rest. The best position for her, if permitted, would be, remember, if we're feeding someone, we can't feed them laying flat. What was the name of the position that had semi and also high? All right, that would have been the Fowler's position. So I'll read through all of these, but Trendelenburg is when we put their head lower than their feet, and we usually only do that when someone is dizzy, okay? And your nurse would usually do that because there are times when even if they are dizzy, let's say they're dizzy and they're short of breath, we're not going to be putting them in Trendelenburg. Hyperextension. Okay, you're taking them beyond their normal limits. We're not going to do that to a resident. Dangling at the side of the bed. We can't do that because the question or the sentence here says she's on bed rest. So we're going to keep her in bed, but we're going to elevate the head of the bed. And so this answer says D, semi-Fowlers. I tell all of our students to put the patients in a high Fowlers position, but that was an option. So let's see if D is okay. All right, semi-Fowler's position is correct because the patient is on bed rest. All right. 35, when caring for a patient with a nasal gastric tube, that's a tube that goes through the nose, down into the stomach. We can use that for feeding if the person is unable to eat. Let's say they had a recent throat surgery, or we can use that to aspirate, to suction. Let's say they're vomiting a whole bunch. That way we can pull out those excess fluids. So when caring for a patient with a nasal gastric tube, you should A, offer the patient water if she starts to gag. B, take the tape off the nose if it bothers the patient. The tape is there to secure the nasal gastric tube. If you move it even a little bit, that means that the tube could be improperly placed. So only nurses should be repositioning that tape. C, never unfasten the connecting tubing from the patient's gown. Well, that's not true. B, protect the tube when moving or changing the patient's position. Definitely yes, because if you have a tube in your nose and someone's just moving things around, that tube is also moving. Or moving the tube. Remember, the tube is just not in the nose. It's going down the back of the throat into the person's stomach. So I think the best answer is going to be D. Yes, you must ensure that the tube is not dislodged. 36, to prevent a patient from getting bed sores, you should A, wash urine and feces off with water only. We all know that's not the correct answer. B, put baby powder on the skin to keep it dry. C, rub the reddened area once a day. So we're not massaging bed sores, just FYI, don't do it. D, turn the patient every 2 hours. All right, and I know you know the answer. Yes, it is D as in dog, but let's just reconfirm. And yes, turning the patient is the best way to protect against bed sores. 37, when moving a wheelchair on or off an elevator, you should stay A, behind the chair, pulling it toward you. B, behind the chair, pushing it away from you. C, in front of the patient to observe his or her condition. D, to the side and hold the door open. When moving a wheelchair on or off an elevator, you should, I don't know if it's A or B. I'm probably about to miss this one too. Behind the patient, behind the chair, pushing it away from you. I'm going to say D. I'm sorry, I'm going to say B as in boy. I need to study for my CNA exam, even though I'm a nurse. You must stay behind the chair to control it, but it should go on and come off the elevator backwards to prevent the wheels from falling into the door opening. I know we all do this wrong, but this is what the state says we should do. So remember that on your state examination, okay? I've missed 4 so far. 38, what position should a patient be in to receive an enema? I know that one. Supine, Fowlers. Prone is when they're face down on their stomach. Left Sims. And so when you think about the Sims position, if I tell you, hey, we need to give the patient an enema, of course you can't give the medicine, but I'm telling you that so that you can prepare the bedding, put those extra pads in the room and under the patient. Whenever you're done turning the patient, placing those pads, I would ask that you leave him or her on his left side. And then I will come in and raise the right arm, raise the right leg, and I can administer the enema. That helps the medicine get further into the colon. So the answer should be D as in dog. And that is correct. The correct answer is left Sims. This allows better irrigation of the colon. 39, nursing orders frequently instruct you to assist a patient to cough and deep breathe. This activity helps the patient avoid A, decubitus ulcers, B, pneumonia, C, internal bleeding, D, dyspnea. And so whenever you see the prefix DYS, that means pain or difficulty. And so you helping a person cough and breathe is going to help them prevent developing pneumonia. Removing those fluids that's in the lungs, hopefully encourage them to deep breathe, will help move them, and helping them cough actually brings that fluid out. So hopefully I'm right. And the answer is B as in boy. Yay, I'm redeeming myself. Coughing and deep breathing forces lower lung movement. All right, question number 40. A patient who has difficulty chewing or swallowing will need what type of diet? A, clear liquid. B, low residue. C, bland. D, mechanical soft. If they have difficulty swallowing, we normally do not give them thin liquids. This did not say anything about adding thickener. And so a clear liquid diet is usually something that we would give to someone who's post-op in case they vomit. We don't want them to have food particles. We start off with clear liquids. Low residue means like low fiber. Bland, like bananas, rice, apples, and toast. But it doesn't say, if you're giving someone toast and they're having a hard time chewing or swallowing, they could swallow a large bite of food and that could be detrimental. So the best answer is going to be D. When you notify me, the nurse, and you're feeding a patient and they start coughing or they're having difficulty swallowing, you notify me, I will come and assess, and then I will go ahead and notify the doctor. The doctor will more than likely order a speech therapist consultation where they'll do like a swallowing evaluation. And based off of that evaluation, they will let us know if the person needs a mechanical soft diet, thickened liquids, etc. And so I think the best answer for number 40 is D as in dog. And yes, it is. A mechanical soft diet is always easy to chew, swallow, and digest. 41. How often should you total a patient's intake and output records? A, once a shift. B, twice a day. C, every 4 hours. D, every 12 hours. And so normally you want to do your totals at least once per shift. And your shift could be a 4, 8, or 12-hour shift. I'm not sure where you're working. And so hopefully this is correct. And yes, intake and output are total once per shift as well as every 24 hours. 42, the Foley bag. That's a urinary drainage bag that collects the urine. The Foley bag must be kept lower than the patient's bladder so that A, urine will not leak out, soiling the bed. Your system should be a closed system, so urine should never leak out, whether it's in the right position or in the incorrect position. If that happens, please notify your nurse. Option B, urine will not return to the bladder, causing an infection. Possibly. Option C, the bag will be hidden and the patient will not be embarrassed. Or D, the patient will be more comfortable in the bed. So whenever you have somebody who has a urinary drainage catheter, you never want to bring that bag up above the bladder, because in doing so, old urine can travel back into the urinary system and cause an infection. So the answer should be B as in boy. And yes, we are correct. Raising the bag above the bladder level can lead to a backflow of the urine with its bacteria into the bladder. 43, when assisting a nurse to irrigate a patient's bladder, you notice that the nurse has contaminated the sterile field. You should tell her. A, tell the doctor right away. B, tell the charge nurse right away. C, offer to get the nurse another sterile pack. That's a good CNA. D, ignore it because the nurse is doing the procedure. No, we are a team. And if a nurse is irrigating someone's bladder and she contaminates a sterile field, that means she's now putting germs into the patient's bladder, and that patient is not going to get better. They're going to have an infection. And so I would nicely ask, would you like another sterile pack? You're there to assist. And so hopefully she will be appreciative of your efforts. And the answer is C. The nurse may not realize she or he has done this. Nurses are humans too, and they make mistakes. 44, as I've already missed 4 questions, I thank you for loving me regardless. 44, when distributing drinking water, the nursing assistant should A, use only disposable cups and pitchers. B, give ice to all patients. C, follow the policy of the institution. D, make sure that all pitchers are filled completely. Oh man, this one's a hard one. I've not seen disposable pitchers, so I don't think it's A. I don't like cold beverages, so to give me ice would be a waste of your time. Some patient could be on a fluid restriction. So when it says fill all the pitchers completely, D is concerning to me. So I'm going to say C, follow the policy of your institution, especially following COVID, because if you have this one universal pitcher that you take in and out of everybody's rooms, you could actually be contaminating that pitcher and by default, contaminating your patients. So hopefully the answer to 44 is C. Yes, agencies may have different policies. 45, Mr. Kaplan's orders include the notation strain all urine. This means that you should report A, the output in milliliters, B, the color of the urine, C, any complaints the patient makes, D, any particles in the strainer. So I want you to think about the reason why we'd be straining urine. What would actually be in the urine? Maybe somebody actually had some stones, kidney stones. And so if you see any particles in a strainer, that is maybe they actually pass a stone and they'll have less pain. So the answer to 45 should be D as in dog. Ooh, we are doing so good. The purpose of the order to strain the urine is to detect particles, aka stones or calcifications. 46. Swelling caused by excess fluid in body tissues is called A, fluid intake, B, diarrhea, C, perspiration, D, edema. You all know this one. The answer should be D as in dog, edema. The term given to fluid held in the body tissues that may cause them to swell is edema. I did not make this test, so don't write me about that misspelling. I love y'all. 47, Mr. Black is a diabetic. Mrs. Black is a diabetic. For her mid-afternoon nourishment, the kitchen has sent a carton of chocolate ice cream. Where is she at? Your first action should be to substitute Diet Cola for the ice cream. Or B, hold the nourishment and report to the team leader. C, ask the ward clerk, this is an old test, to notify the kitchen of an error. D, ask Mrs. Black if she likes the ice cream. Look, my baby CNAs, get that ice cream away from her, because if you leave it in her room, even if she is a diabetic, she is going to eat it. And you don't want to replace it. It's like bribing her. You know what? Give me the ice cream and I'll give you a Diet Coke. All right, so you're going to hold it and you're going to report it to the team leader. For your CNA examination in the state of Florida, that term team leader would be charge nurse. And that way the nurse would be able to notify the dietary office or department that your patient received the wrong tray. They should have received a diabetic tray and not a regular diet. Yeah, and the answer is B. Always report out normal conditions. 48, your assignment sheet has the following notation: S and A, C, TID for Mr. Abel. This means that you should A, take the axillary temperature and systolic blood pressure after care is given 2 times a day. B, do a routine sugar and acetone urine test before meals 3 times a day. Do a routine sugar and acid stool test after Mr. Abel's next 3 stools. Offer snacks and ginger ale 3 times a day. You all, S and A is not an approved abbreviation in the state of Florida. AC is before meals and TID is 3 times a day. So let's see if one of these specifically states before meals and 3 times a day. All right, so I'm going to say it is this one because AC stands for before meals and TID stands for 3 times a day. So I'm going to say it is B, but your facility will have a list of approved abbreviations. And so that's why we ask that you don't write things that we don't understand, because I have never, and I've been a nurse for 24 years, never seen the abbreviation SNA. So let's see. I think it's B. Woohoo! Process of elimination. SNA is a diabetic test done on urine before meals. 48, Mr. Brooke has a broken hip and needs to have an enema. The best type of bedpan to use would be A, fracture pan, B, plastic pan, C, child size pan, D, metal pan. And a fracture pan is that little slender kind of angled bedpan that has a handle that you can easily slide under a patient who doesn't have the mobility, who can't lift a whole bunch. So the answer to 49 is A as in apple. All right, so choose a fracture pan. So Mr. Brook will have a minimum distance to lift his hips. 50. Before you ambulate a patient who has a Foley catheter, remember that urinary drainage bag, you should A, clamp off the catheter and disconnect it since the bag would be in the way. Absolutely not. B, leave the catheter dangling between the patient's legs. Come on, absolutely not. C, carry the bag below the level of the bladder. C, hide the bag in a pillowcase so the patient will not be embarrassed. This is about recovery, not about embarrassment. And when you're in the hospital, they won't have a leg bag or a leg strap per se. You would just have to hold the bag, but hold it in the proper position. So the answer is going to be C as in cat. You cannot disconnect the bag without an order, but you still must ensure that the bag remains below the bladder level. All right, you all, guess what? That is the conclusion of our test. I thought there were 60 questions, but there are only 50. And so if there are 2 points each and I missed 4, my overall score would have been a 92%. And I know some of you all did better on this test than I did. Regardless, I hope you have fun. Thank you for spending this hour with me. And if I can be of any further assistance, my name is Eunice Mathis. I'm the owner of Florida Training Academy. I wish you the best of luck on your CNA exam prep test and your future endeavors, whether that's going to be nursing or pre-med school. We appreciate you and we thank you for watching. Bye, everybody. Hello, everybody, and welcome. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In today's video, we're going to be reviewing 60 practice CNA exam questions and the rationales, but here's a kicker. I've never taken this exam before, and I want to see if you are smarter than a nurse educator. So we're going to work through these questions together. If I do answer something incorrectly or if I say anything that is imperfect, remember to blame it on my brain and not my heart. I will not be editing this video because this video is brought to you on behalf of Onaka Monique. Onaka sent a message this morning. Thank you for being a subscriber and said that we need more CNA practice exam questions. And so there you have it. If you're in Jacksonville, if you're in the state of Florida and you're looking for hands-on CNA prep, our website is www.fltraining.com. Not only do we provide the CNA exam prep courses, we have a workbook that you can purchase online, and then we do the CNA trainer and CNA trainer and CPR instructor training classes. So we're pretty much your one-stop shop for those who are either in entry-level positions or those who are in more advanced positions like doctors and nurses. All right, everybody, let's go ahead and start this exam. All right, and again, I have not seen this exam before, so hopefully I do well. All right, question number 1. The nurse aide is using an electric shaver to shave a client when it begins to spark and smoke. Which of the following actions should the nurse aide take? Call the nurse in charge. Finish shaving the client as quickly as possible. Use the roommate shaver to finish shaving the client. Unplug the shaver. And of course, we want to prevent a fire and to keep our client safe. So we're going to unplug the shaver. We can always go back and, resume the shave later once we have better equipment. Question 2, the nurse aide is caring for a client who has right-sided paralysis. That means that either one side doesn't move at all or one side is extremely limited due to maybe an auto accident or an injury, or it also could have been due to stroke. And so the nurse aide should place the signaling device on the left side of the bed near the client's hand, on the right side of the bed near the client's hand, under the pillow at the foot of the bed. Well, we automatically know the last two are not the best options. You would not want to place the signaling device on the right side because your patient has right-sided paralysis. They'd have to reach across their body in order to get the device. So the best answer is going to be the first option. And remember to stay until the end so that you can see what questions I answer correctly or incorrectly. Question number 3, the nurse aide is preparing to lift a client using proper body mechanics. The nurse aide should. Remember, you always want to lift with your legs. You want to save your back. Keep both feet close together? Absolutely not. You want to have a wider stance whenever you're lifting. Lift with abdominal muscles. Nope, that is going to hurt. Bend knees and keep back straight. Hold the object away from your body. No, you don't. You want to have it closer to the center of gravity. So the best answer is going to be this third one. Question 4, the nurse aide is caring for a client who needs to be transferred. The nursing care plan states transfer with a mechanical lift. However, the client is very agitated. To transfer the client, the nurse aide should. Look, my CNA babies, anytime you are using a mechanical lift, I don't care how short-staffed your facility is, it always requires 2 people. Okay, whether the client is agitated or not, one person has their hands on the client and the other hand actually maneuvers the lift. And so let's see what our options are. The first, lift the client without the mechanical device. Well, that'll be going against the doctor's orders. It required a mechanical lift to transfer the resident. So that is not the option. The second, place the client in the lift. The third, get assistance to move the client. Fourth, keep wheels unlocked. Now, if you're transferring somebody, you're always going to have wheels locked, whether that's on the Hoyer lift, the bed, or the wheelchair. So the best answer is this third one. We're going to get assistance to move the client. Question number 5. The nurse aide is assisting a client while eating. The client begins to choke and turn blue. That is a medical emergency. The nurse aide should immediately remove the client's food tray and go find the charge nurse or the nurse in charge. You will never leave a person who's at risk of injury alone. You're going to stay with that person and render aid, whether the aid is the abdominal thrust or if it's providing CPR if we're unable to clear their airway. All right, so we know the first one's not the answer. The second one says slap the client on the back until the food dislodges. Well, when you're hitting someone in the back, you actually make the food go further down. You do not promote it coming up and out. Call for assistance and perform the Heimlich maneuver, also referred to as abdominal thrust. To me, that's the best answer. And number 4 says give the client a drink of water. You're not going to give someone water when they're turning blue. And if they're aspirating, you don't want to give water because the water can follow the path of the food and go into their lungs. So the best answer is going to be the third one, call for assistance. Question number 6, the nurse is providing evening care for a client with a full set of dentures. Proper procedure requires that the dentures be placed in the client's bathroom on the sink, in tissue on the bedside stand, under the client's pillow, in a denture cup with the client's name on it. Well, we know those dentures are super expensive. And if a person doesn't chew their food properly, they're going to be at risk of aspiration. So we want to keep those dentures safe. And the best option is going to be this fourth option. Put those dentures in a cup and make sure we have it labeled properly. Question 7, what type of fire can be put out with water? Electrical. Water and electricity do not mix. Grease, absolutely not. You're going to make the fire worse. Paper, possibly. Chemical, we don't know what chemical, and some chemicals react with water. And so the best answer for this option is going to be paper. However, in your facilities, they should be teaching you PASS, and that's the acronym that we use whenever we're talking about fire safety and how to use a fire extinguisher. If you remember what PASS stands for, I want you to go ahead and put it in the comments. All right, I'll give you a few moments. It's pull. You want to pull the pin. You want to aim towards the base of the fire, you want to squeeze the nozzle, and you want to spray from side to side. And that's how we're going to extinguish a fire using a fire extinguisher. Question number 8, the nurse aide is responsible for all of the following fire prevention measures except. So which one is not your responsibility? Taking cigarettes and matches away from all clients and visitors. Usually if the answer option has all in it, I automatically know that that is not something that we would normally do because care is individualized. And so I'm leaning towards this first one, but let's keep reading. You would not be expected to be aware of the locations of fire extinguishers. Well, that's not true. You would not be expected to report all damaged wiring. That's not true. And you would not be expected to perform or participate in fire drills. Well, the last 3 are things that you're supposed to do. And so since this question asks what you're not supposed to do, it asks for the exception. The exception is this first one. And so when you're taking your CNA examination, do not assume that you're working in a hospital that has a smoke smoke-free or no smoking policy. You're taking care of an adult resident, and that could be someone who is homebound, someone who lives in an assisted living facility. And yes, in some of these facilities, the clients and the visitors are actually allowed to smoke. Question number 9, the nurse is preparing to help a client walk from the bed to a wheelchair. Which of the following should the nurse aide put on the client's feet? Socks or stockings only? That's a guaranteed way to have your patient slide to the floor, so absolutely not. Cloth-soled slippers? No. Rubber-soled slippers or shoes? More than likely that is correct. Nothing. Absolutely not. You're not going to be walking your patients barefoot, and you're not going to be walking them with anything except for something that has grippies or some type of rubber bottom and to help prevent a fall or a slide. So the best answer is this third one. Question 10, the nurse aide understands that the most important reason for using soap and water to clean the client's skin after elimination is to keep the client happy, prevent soiling of bed linen, remove feces and urine from the skin, keep the linen costs down. And of course, we know it's going to be the third one. You want to keep your residents skin clean and dry. That's going to prevent infections, and it's also going to prevent skin breakdown, which could cause pressure sores. Question 11, the nurse aide should refuse to perform a task if the nurse aide has never been trained to do so. Bingo. All right. So in your facilities, usually CNAs, I know in the real world, CNAs may train CNAs, but according to laws, nurses train CNAs, specifically RNs train CNAs. And so if you haven't been trained to do something, you're not supposed to be doing it. But let's read the others. You should perform a task. You should refuse to perform a task if the client is difficult to deal with. If the nurse aide can find someone else to do it, if it's the end of your shift, you should refuse to perform a task. And so those are not the correct answers. You're going to refuse to perform a task if you have not been trained to do so. Ask your nurse to teach you. Question 12, before helping a client into a bath or a shower, the nurse aide should first check the temperature of the water, shampoo the client's hair, soak the client's feet, apply lotion or oil to the client's skin. The last one means that you're going to be putting a slippery substance on a patient's feet and then taking them into the shower or the tub. Well, that's a recipe for disaster. We're not going to do that. You don't have to soak someone's feet before you give them a bath. You will not be shampooing everyone's hair during the bath or the shower. The safest option before you put a client into the shower or the bath, you want to check the temperature of the water first, and then you have the client actually check it second. Question 13, when taking a client's radial pulse, the nurse aide's fingertips should be placed on the client's chest, wrist, neck, elbow. And this is requiring for you to know where like the radial artery is. And so the radial artery is located in the wrist, right beneath the thumb. And whenever you think about the radial pulse, not the carotid pulse, carotid would be here. The radial pulse is here. If your patient's responding to you, you're not going to be feeling for their carotid pulse. This is when you think of this, think of CPR. So the radial pulse, you would hold it for 1 full minute. When you're taking a pulse, remember you cannot use your thumb to take a pulse because your thumb has its own pulse. And in theory, you'll be counting your own heart rate. So 2 or 3 fingers, wrist area, radial pulse. Question 14, a nurse aide reports directly to the nurse supervisor, physician, staff development nurse, administrator. All right, so we know that you report directly to a nurse, but I need you to understand the differences in these 2 types of nurses. All right, so the staff development nurse, I want you to think of your orientation when you were first hired to your facility. And there was a group of nurses within a room and they were teaching you skills, watching you perform hand hygiene. And so that person who's doing the training is the staff development nurse. If there's an issue on your floor, you're not going to be going to the trainer. You're going to be going to your nurse supervisor. Question 15, when communicating with a client's family, the nurse aide should listen to concerns and offer support, offer advice about the client's medical treatment, get involved in the family problems, share the latest facility gossip. All right, so the last 2, absolutely no. And then you as a CNA, you don't give advice about medical treatment. You are not a physician. You be stepping outside of your scope of practice. The physicians advise about the medical treatment, and they create a treatment plan, which the nurses and the CNAs follow. So the best option here is you're going to listen to the concerns and offer support. Question 16, the nurse aide is making an empty bed and notices that the side rail is broken. The nurse aide should wait for the next safety check to report the broken side rail. Report the broken side rail immediately. Tie the side rail in a raised position until it is fixed. Warn the client to be careful when getting back into the bed. Well, of course, it's not going to be the last one because this said it was an empty bed. And so we're going to go ahead and replace that bed before we ever put a client in the bed. And so the best response is going to be to report the broken side rail immediately, and you work with your nurse so that we can get a new bed in that client's room. Question 17, the nurse aide is caring for a client who becomes incontinent of urine right before dinner. And sometimes the CNAs don't understand the differences between incontinence and retention. If someone's retaining urine, then they're going to have bladder distension, they're going to have some lower abdominal pain, and that would be a medical reason for a nurse to insert a catheter. That is the opposite of incontinence. When someone's incontinent, they can't control their urine. They can't control their bowel movements. So they're wet. That's why they call them incontinent pads or incontinent briefs. It's because the person has moisture down there. And so if a person is incontinent right before dinner, what do you think you should do as a nurse aide? The first option says take the client to the dinner table and clean up after dinner. The second is clean the client and take to dinner as soon as possible. The third is tell the client not to eat until the client has cleaned and changed self. And lastly, insist that the client eat dinner in the room. But we're not going to be lazy, and we're always going to prioritize patient care. So the best option is going to be clean the client and take the client to dinner as soon as possible. All right, so question number 18. The nurse aide notices that the client's radio cord is draped across a chair in order to reach the nearest outlet. The first thing the nurse aide should do is tell the client the radio is a safety hazard and take it away. Unplug the radio and ask the client not to use it. See if any changes can be made so that the radio can be plugged in safely. Take the radio to the activities department or activities room and tell the client to listen to it there. Where I want you to think about these clients, and if this client has a radio, more than likely they prefer that versus the TV. And so I want to keep this client happy so that they have some fulfillment and joy in life. I'm not going to take the radio away. I'm going to work to see what changes can be made so that the client can actually enjoy the radio. Maybe we need to maneuver some things in the room. Usually electrical extension cords are not allowed in your facilities, but we can find a way to allow this resident to keep their radio, even if it means we have to use like rechargeable batteries or something. So let's find a way to keep our clients happy. Question 19, the nurse aide is walking with a client who is confined to a wheelchair when a facility fire alarm is activated. The client becomes excited from the noise. The nurse aide should. So anytime there's a fire, the acronym you need to know is RACE, R-A-C-E. R stands for rescue, A stands for alert or alarm, C stands for confined, and E stands for extinguish or exit the building. And so I want you to keep that in mind. We need to race because there's a fire. So are we going to push the wheelchair out of the hallway and carry somebody who's wheelchair bound out of the facility? Are we going to leave the client to search for help? Are we going to comfort the client while moving them to a safe place? Or are we going to lock the client's wheelchair and check the surrounding areas for smoke? Now, the only option that made that client safe is going to be the third option. And remember to race if there's a fire. 20, the nurse aide notices a client spill water on the floor in the hall. Another client is walking down the hall. The nurse aide should. We're going to call the nurse, clean up the spill, call housekeeping, or leave the spill. You saw it. Clients are in immediate risk of falling. I need for you to clean up that spill right away. We are not waiting for housekeeping, and you're not going to be calling a nurse about a spill. Question 21. For safety, when leaving a client alone in a room, the nurse aide should keep the door tightly closed, place the signaling device within the client's reach, apply a restraint to the client, leave the bed in the highest position. Well, the last two options are the exact opposite of what we're going to do. All right, we're never going to leave the bed in the highest position. You leave the bed in the lowest position. And we don't apply restraints just for the sake of applying restraints. A patient would have to be a danger to themselves or others. If a patient is falling or they're a fall risk, we don't restrain them. We can get a bed alarm, we can get a sitter. There are least restrictive ways to keep people safe. And plus, when you restrain someone, you actually increase their chances of injury because they're going to be fighting to get released, right? And so the best answer is going to be place the signaling device within the client's reach. That way, even though they're in the room alone, if they need help, they can just call for assistance. Question 22, the nurse aide understands that physical restraints may be used to prevent client injury when staff is short at the family's request, at the roommate's request. All right, and so the best answer is going to be to prevent client injury, and restraints require an order from a doctor and frequent reassessments. You'll be checking vital signs about every 15 minutes. And so if you restrain someone, that's really serious because, again, the patient can harm him or herself just by trying to get out of the restraints. Question 23, the nurse aide is concerned about a client's care. Which of the following should the nurse aide speak to first? Another nurse aide, the nurse in charge, the director of nursing, the administrator. Well, your nurse in charge is responsible for that floor for that shift. And that's like your immediate, your most available nurse, charge nurse. The director of nursing is responsible for the entire floor 24/7, where even at nighttime, if there's an emergency that happens, there's going to be an email, a text. That director of nursing will have to address that when he or she returns. And so if there's an immediate need with your patient, you're going to actually notify the nurse who's right there with you, your nurse that's in charge. Question 24, the nurse aide is preparing to take a client's oral temperature. The nurse aide should place the thermometer in the rectum, place the thermometer under the arm, place the thermometer under the tongue, put lubricant on the thermometer. Well, that's just nasty. The best option is going to be the third. Question 25, the nurse aide should understand that pressure ulcers can often be prevented if the client is placed in an incontinence brief, positioned with a pillow under the head, dressed in loosely fitting clothing, turned or repositioned every 2 hours. And of course, we have to reposition patients in order to decrease those pressure sores. And usually if you put someone in an incontinence brief, that moisture is still trapped against the skin, and that actually increases their chances of getting the bed sores, which is why a lot of your facilities either have a no diaper policy, a diaper-free policy, or for women, they'll use like the Purex, which will wick away the moisture. And for a male, they'll have like a condom catheter to drain the urine away from the peri area. Question 26, the nurse aide is caring for a client with hand tremors. The nurse aide should restrain the hand that has a tremor, assist the client with the activity of daily living as needed, tell the client to stop shaking and control the tremors. Do everything for the client. All right. And so we're never going to do everything for a client. Our job is to rehabilitate them. And so even if a person has had a stroke on one side, you're going to encourage them to be as independent as possible for as long as possible. So their unaffected side will be the one that you encourage them to use and to comb their hair, etc. And so if you have a patient who has an inability on one side due to the tremors, you're going to assist them as needed. Okay. Don't do everything for them. Question 27, the nurse aide is assisting the client in resolving grievances. The nurse aide should report the grievance to, a grievance, think of it like a complaint. The nurse aide should report the grievance to the doctor, the family, the administrator, or the nurse in charge. And we know that you know that answer, the nurse in charge. I hope you all are doing very well on this test. We're almost halfway done. And at the end, you'll see if you are smarter than the nurse evaluator. Again, my name is Eunice Mathis with Florida Training Academy, and we're on question number 28. 28, when providing care to a client, the nurse aide should should avoid unnecessary exposure of the client to protect the client's right to privacy, confidentiality, personal choice, personal hygiene. All right. And so this one is going to be the right to privacy. For example, let's say that your client vomited and you're going to be doing a partial bed bath. You're going to clean his face, his chest, and maybe change his gown. Well, while you're in the process of cleaning, you don't remove the entire gown and leave the body fully exposed. You would only expose the part that you're going to be washing, and just in moderation, maybe put a towel or a bath towel on top of the resident to prevent the overexposure. So the best answer for this one would be the first option. 29, the nurse aide should understand that the female perineum, think of the genital area, should be cleansed from front to back without soap, with a disinfectant, ouch, from back to front. And so the best answer is going to be from front to back. You're always cleaning from the clean area towards the dirtier area. If you clean from back to front, you're taking fecal matter and moving it towards the vaginal area, which is the wrong way to wipe a woman. Question 30, when caring for a client from another country, the nurse aide should be sensitive to the client's cultural needs, orient the client to the cultural practices of the facility, promote group activity participation, and decline to care for the client. All right, and so we're talking about from another country, so we need to be mindful of the different cultures, and we're going to be sensitive to the cultural needs. And the only time the cultural needs are, going to be a concern, and if you do have a current concern, you refer that to the nurse, is if maybe the person wants to smoke a cigar or something, and I'm not sure if that's, a part of any culture, just giving you an ideal, where of course we know that may not be part of your facility's policy or practices. So that'll be something that you actually want to refer to your nurse. But outside of that, you're going to be sensitive to their cultural needs. And if it's not hurting anybody and it's not going to, cause any issues, you actually want to adhere to their cultural needs and their request, such as a diet order. Question 31, the nurse aide should provide oral hygiene to a client who is unconscious at least every 2, 4, 6, or 8 hours. And believe it or not, I know we don't see this in practice. The answer is every 2 hours. But let's talk about the person who's unconscious, the person who could be a mouth breather, or the person who could be intubated. When those germs grow and accumulate and they go further down, the person can develop pneumonia. If it gets into the bloodstream, they can become septic. So it's really important for us to keep their mouth clean. However, when you are providing oral care to an unconscious person, more than likely they don't have a gag reflex. And so for a person who can speak to you, we normally sit them upright in a high phallus position. However, if a person is unconscious, you're going to put them in a sideline, a lateral position. That way, any secretions, because they're going to accumulate when you're cleaning their mouth with the tooth at, any secretions that actually accumulate, they would go ahead and pull in the cheek area, and then you can suction them out. So that's just FYI. If they're unconscious, you do not sit them straight up in order to clean their mouth. You're going to put them on the side. Question 32, the nurse aide is caring for a client who needs assistance getting out of bed to sit in a wheelchair. Which of the following actions by the nurse aide would make this a safe procedure? Place the bed in a low position. Place a pillow on the wheelchair seat. Lower both footrest pedals. Release the wheel brakes. Well, the last two options are exactly the opposite of what you should be doing. You would never release the brakes. You would actually apply the brakes before you transfer someone. You would not be lowering the footrest or the pedals. You'd actually raise them. And so if you have your patient stepping over the pedals of the wheelchair in order to get into the wheelchair, that is a safety hazard. Lift the pedals. The person's path to the wheelchair should not be impeded. There should not be anything blocking your patient's path. And so the last two options are not the best option. The best option is going to be the first. You want to have that bed in the lowest position before you attempt the transfer. Question 33, a visitor enters the room while the nurse aide is changing the client. How should the nurse aide respond? Can't you knock? Hi, come on in. Boy, he was dirty. Would you please wait in the lobby? And of course, we're going to respect the patient's right to privacy, and we're going to get the visitor to wait until we are done with this bath. Question 34, a client looks forward to playing bingo each morning. The nurse aide should tell the client that the nurse aide does not have time to get the client ready for bingo. Plan the client's schedule so the client is bathed and dressed in time for bingo. Tell the client that the nurse aide forgot about bingo, but they'll go the next day and ask the client to bathe and dress themselves. And so, again, we talked about the quality of life and what makes these clients happy. And if this person looks forward to going to bingo, as a good CNA, you're going to make sure that your client goes to bingo. So you're going to actually plan the schedule a little bit better and then help them get dressed. 35, the nurse aide is caring for a client who is confused and disoriented. The client starts begging to go home. Which of the following would be the best action for the nurse aide to take? Tell the client, this is your home. Take the client to the activity room, I guess as a form of distraction. Ask the client to tell the nurse aide about his or her home. Tell the client, we'll take you home later. You don't want to lie to your patients. You don't want to give false reassurance. So you want to be honest. And the best response right now is just to listen. And so if this person wants to go home, ask him or her to tell you about his home. Maybe there's a special blanket, a special pillow. Maybe it's something we can actually bring in from their actual home into the nursing home or the facility so that they would be more comfortable. Question 36, the nurse aide is caring for a client who's alert and oriented. The client touches the nurse aide inappropriately. Which of the following actions should the nurse aide take? Slap the client's hand. And I'm not going to say that's wrong. I'm just going to say it's not the right answer for this test. Step back and ask the client not to do it again. Refuse to care for the client. Warn the client that the behavior may be punished. And so we're going to let them know that they have overstepped their boundaries and they've actually, you're not comfortable being touched that way. So you're going to step back to protect yourself and you're going to tell the client not to do it again. And then after that, you're going to go ahead and tell the nurse. And when you tell the nurse, if I were the nurse, I would go in and have a conversation with that resident and let them know what we're not going to allow in our facility. And if it continues, of course, we can escalate it further. But if you don't feel comfortable at that point, maybe you can ask another CNA to go in and assist you whenever providing care. Again, you cannot delegate, so you can't give your assignment to another CNA, but a good nurse would work with you to make sure that you're going to be protected whenever you take care of this particular client. Question 37. The nurse aide is caring for a client with Alzheimer's disease who wanders from room to room, moving the belongings of other clients to different locations. The other clients who are alert and oriented are angry that their things have been removed. The nurse aide should return the client to the client's room and close the door. We're not going to lock somebody up who has Alzheimer's. They wander. That's what they do. The next one is find the missing articles and return them. Walk with the client to keep them from wandering. You're just going to be wandering with the client because that's what Alzheimer's patients do. They walk, they pace. The last one is assure the other clients that the client with Alzheimer's disease will not harm them. That would be false reassurance. Absolutely not. I don't care if the person didn't harm me. If I wake up at midnight and I see a person hovering over me, I'm trying to steal my pillow. It may not harm me, but it would, pretty much scare me a whole bunch. So we're not going to give any false reassurance. We will, however, just for the sake of this question, we're going to find the missing articles and return them. And then you're going to work with your nursing team to prevent this, person from taking other people's items. Maybe we have to close the room doors when this person's out wandering. 38, which of the following is a restraint alternative? All right, so if you put a lap buddy, if you put that tray over your person's lap, that's actually considered, and they're not eating, that is considered a restraint. A sedative, well, a chemical sedative is actually a restraint. It's a chemical restraint. Pain management, I'm a little bit leery about this one, but I know that a hand mitt is also a restraint. So I'm going to go with pain management. And when you think of pain management as a CNA, you're not giving pills. So what does a CNA do to improve someone's pain? All right, so is it massage? Is it heat therapy, ice therapy? Is it range of motion? All right, so I think that would be a good alternative to a restraint. And it's the best one for these options, because everything else is actually either a physical or a chemical restraint. And we're going to see in a few moments if you're smarter than a nurse evaluator. All right, so 39, the nurse aide can provide the client with a sense of security by rushing through care, leaving the room without speaking, explaining all routines and procedures, talking to another nurse aide while providing care. The last one is just plain old rude. All right, so you want to explain all routines and procedures. Think about it when you go to the doctor's office. You've been waiting there for a whole hour and no one's updated you. You have a sick kid and you just feel lesser than and like no one really cares about you. You don't want your clients and residents feeling that same way. So I want you to explain all the procedures to them as you're going to be performing them. Question 40. The nurse aide is caring for a client with a protective device, such as a restraint. The nurse aide should assess the client once every hour. We've already discussed this. Assure the protective device is tight. Check the client's body alignment. Release the protective device at least once per shift. And so when it says tight, anything we put on the body, it could be an ACE bandage, it could be a gauze. We want to make sure, like a rolling gauze, we want to make sure that at least 2 fingers can go in between the device and the actual patient's skin. And that means that the person has enough room for blood to circulate. So we're not going to put any device on them and just make it tight. We know that we're going to check them more than just once an hour. So the best option is going to be check the resident's body alignment. And then as far as only releasing a protective device once per shift, no, they need range of motion. And so if a person has bilateral hand restraints or wrist restraints, you're going to simply partially release one restraint for a few minutes, let them move around a little bit, and then you're going to restrain it again and repeat that process on the opposite side so that your patient does have movement. Question 41, the nurse aide is caring for a client with an ostomy, okay, and that's the opening where the colon is coming out the skin. The nurse aide, what should the nurse aide do first when changing the ostomy bag? All right, put on gloves, wash hands, explain the procedure, wash the area around the stoma. And to me, the best option is going to be explain the procedure. Because if I put on gloves and if I wash my hands and put on gloves and then explain the procedure and the patient's like, oh no, I don't want you providing my stomach care. My wife's going to come in and do it. I just wasted time. So explain the procedure first and of course get the resident's permission before starting the skill. Then you can wash your hands, don gloves, and wash around the stoma area. Question 42, when given a back rub to a client, the nurse aide should use circular motions over bony areas. That one's a little bit concerning to me. It didn't say reddened bony areas, but usually we do circular motions to improve circulation. However, when it's a bony area and if it's reddened, you probably don't want to be massaging that area. But I'm not going to overthink this particular one. It did not say reddened. Okay. And the next one is place the client in the supine position. Well, when you're trying to provide a back rub, whenever you think of the supine position, take the U out. When someone's in the supine position, they're laying on their spine. So you can't provide a back rub if they're actually laying on their back. Use short, light strokes. That's not usually how we give a back rub. And then the last one says, warm the lotion in the microwave. I don't have to read anymore. You warm lotion in your hands, not a microwave. All right, so we're going to choose this first option. Question 43, what is the first thing a nurse aide should do when finding a client who is unresponsive? Anytime there is a change in condition, you alert others. You get a nurse in the room. However, you cannot leave the room because if you have to perform CPR or something, we need you there. So when a client is unresponsive, the first thing you do is call for help. Wouldn't be start compressions because just because someone's unresponsive does not mean they're in cardiac arrest. Your diabetic patients could be unresponsive due to low blood sugar levels. But when you call for help, while you're waiting for help to come, that's when you can do your BLS assessment, your basic life support assessment, where you're tapping and you're shouting and you're checking for a pulse and breathing. And that will help you determine whether or not CPR is actually needed. 44, when operating a manual bed, the nurse aide should remember to. All right, so ladies and gents, a manual bed is an old-fashioned bed. The fancy beds they have right now, you use a device to raise and lower the head of the bed, to raise and lower the foot of the bed, and that same controller allows you to bring the bed frame up to a working height. Back in the day, and some places still have the old-fashioned beds where there's a cranking device that allow you to crank the bed up to a working height or lower it all the way back down. The problem with that crank or that metal rod that's sticking out of the base of the bed is that it's a fall hazard. So whenever you get the bed in the desired position, you have to tuck that crank back under. All right, and so when you're operating a manual bed, what should you do? Elevate the client's head at all times. Not necessary. Lock the wheels when the cranks are folded. You're going to lock the wheels pretty much all the time unless you're moving the bed. fold the crank under the bed, keep the bed in a neutral position. And the best answer is going to be the third one. You're going to have to make sure that crank is folded under. Question 45. The nurse aide is preparing to provide oral care to a client who is unconscious. The nurse aide should place the client in which of the following positions? And we spoke of this previously. Is it going to be supine when the person's laying on their spine? Is it going to be lateral, which is when they're laying on their side? Is it going to be prone? They're laying on their face. Sims is a side lying position, but specifically it's the left side down. And we use that for enemas whenever the nurse is going to be giving someone an enema if they've been constipated. And so I come up to you and let's just say your name is Sarah. I say, hey, Sarah, I'm going to be giving Mr. Lucas an enema. And your question to me, Sarah, should be, how long do I have? That gives you time to prepare that bed, put multiple pads on the bed. And as you're repositioning the patient, turning them from side to side, at the end, I need you to leave them on their left side. And when I come in, I'll put the right hand and the right leg up, and that's going to allow me to give the enema the medication, and it's going to follow the flow of the colon better if the person's on their left side. So whenever you see Sims, think of enema, think of constipation. Don't think of the Sims position just because it's a sideline position for someone who's unconscious and receiving oral care. All right, so the best one is going to be this lateral position, side lying, and that allows the fluids, the secretions to accumulate in the side of the mouth or the cheek area. Question 46, the nurse aide should place the soiled linen. Come on, we're going to keep dirty stuff with dirty stuff, so let's make sure we get this one right. On the floor, on the chair, in the dirty linen container, on the overbed table. And this was an easy one, so we're going to put it in the dirty linen container. 47, the nurse aide is caring for a client with diabetes. Which of the following would be the best for the nurse aide to use when shaving a client? All right, so a diabetic client, they sometimes have delayed healing. So if they get a sore or something on them, it may take a while for it to heal. We want to prevent injury. And so are we going to use a safety razor, an electric razor, a disposable razor, or a straight edge razor? And what this question is trying to get you to realize is a safety razor still has a blade. We're going to avoid anything that has a blade. And so the only razor here that doesn't have a blade, it has more like a little buzz razor, is going to be that electric razor. Question 48, the nurse aide is caring for a client who only speaks and understands a foreign language. Which of the following actions should the nurse aide take? Use gestures, using your hands. Speak slower. I hate to tell you, if they did not understand you when you were speaking a normal pace, speaking slower is not going to improve their comprehension. They speak a different language. Listen and say nothing. If they speak a different language and you're listening, are you understanding them? Use an interpretation guide. I have no idea what an interpretation guide is. If you understand, or if you want to look it up and put it in a comment area so you can educate a nurse educator so I can educate other CNAs, I greatly appreciate that. I'm going to say it's going to be using gestures, but we'll see if you're smarter than a nurse educator in a few moments. Question 49, the nurse aide is transferring a client to a different unit. The nurse aide should understand that the most important information needed from the nurse is the phone number to the client's room, the client's medical diagnosis, the name of the client's spouse, the name and the room number. So here's a scenario. We have a patient who's being transferred from a surgical unit and they've been doing great. They're ambulatory now, but we need to transfer them to a lower level of care. And so now they need a surgical bed for a person who is going to be, immediately post-op. So we have to transfer this patient to another room, maybe in the medical surgical unit. And so the only information you're going to need is the patient's name, of course, identification, to make sure that we're transferring the correct patient. We're going to use those two different identifiers. And then after that, you need to know the room number. Your nurse is giving the report to the nurse that's going to be receiving the patient. And I'm sure she's also notified the client's spouse of the transfer. So this is your role as the CNA, knowing the resident's name and what room number they're going to be transferred to. Question 50, the nurse aide should understand that the main purpose of continuing education is for client safety, a review of skills, facility compliance, the improvement of teamwork. All right, and so when I think of a review of skills, facility compliance, the improvement of teamwork, all of that is bundled into client safety. So when you go in and you have these in-services, when they're reviewing your skills, it's to make sure we keep our clients safe. The facility has policies in place to make sure we keep our clients safe. And if you do not communicate or work well with your team, well, then we're not going to be providing the best care. So again, I think the best answer for this one when you're doing your continuing education is for client safety. But if you think it's something else, we'll find out soon. 51, incident reports are written in order to inform the physician, notify family members, identify who's at fault, determine patterns and trends. All right. And so if you're ever written up, if there's an incident report, don't think of it as a nurse pointing their finger at you. We need to make sure that this doesn't happen to a patient again. And so this one helps us determine patterns and trends and actually helps us to develop a corrective action plan so that we can keep our residents and clients safe. 52, the nurse aide should understand that the button hook and a sock assist device are both part of what type of nursing care? Restorative and rehabilitation, activities of daily living, disability and reactivity, prosthetic mobility. So when you think of prostheses, think of something missing, think of something that needs, more support. And so this particular statement didn't say the person had an amputated leg. So it's not going to be prosthetic mobility. I don't know what the disability and reactivity part of nursing care is. Activities of daily living, that's like, bathing, dressing, etc. But this particular button hook and a sock assist device is specifically speaking about rehabilitation, and restoration. And that's normally when physical therapy or occupational therapy will come in and work with the resident. And so if a person has a sock assist device, you want to encourage them to use that device versus you're like, oh, it just takes too much time for him or her to put their own sock on and you go and do it. You're not helping them to be independent. And when they get home, you won't be there to assist them. And so these little assistive devices actually help keep your patients independent and help them be more independent when they're in their own home setting. 53, the nurse aide is preparing to ambulate a patient who is unsteady. It is best for the nurse aide to use a walker, gait belt, quad cane, or wheelchair. In my humble opinion, it's best for the nurse aide to not walk an unsteady person by themselves at all. You will actually need some, human assistance. However, that wasn't an option here. So I think the best option is going to be gait belt. Because the gait belt allows a way for you to hold on to your client and walk with them and actually hold on to them to help keep them steady and stable. If you just have them use the walker, their hands may be on the walker, but if their knees buckle, that's still considered a fall. So I want to have more human assistance. And that's why I think that the second option is the best. 54, the client's Bill of Rights include free medical care, freedom of choice, access to the medicine cart, access to the laundry. The last two are not even necessary in your facility. They don't need access to the medicine cart and they don't need access to your laundry area. So when you think of the Bill of Rights, think about the residents who are allowed to refuse care. They're allowed to participate in care. They can tell you what they want to wear, how they want to dress. And so this allows your residents to have freedom of choice. Question 55, which of the following statements might strongly support that a client is considering suicide? And when someone's considering suicide, it's sometimes do the opposite. Like they'll get really happy and just start giving their items away. So that could be a telltale sign. The first one says, I think I need to see a psychiatrist. Normally, if someone is suicidal, they're not going to be asking for a psychiatrist. I might as well be dead. That is a very good option. I don't really care. We all have to go sometime. All right, and so I really don't know the answer to this one at all. I'm thinking the second one, I might as well be dead, but we'll find out. We're only a few questions away from seeing what my final score is. But if you are fearing that a patient might have homicidal or suicidal ideation, meaning that they may want to hurt themselves or others, you do want to ask if they have a plan. Of course, you're going to notify the nurse, and you're not going to leave anything that the person could use to harm themselves or others inside of their room. You're going to take those items away, and you're going to document it and store them with their personal belongings in a safe area. Question 56, the nurse aide is caring for a client who answers every question by nodding and saying yes. Which of the following actions would be appropriate for the nurse to take? Inform the nurse of the client's behavior. I mean, is that normal? Ask a family member to translate for the client. Speak to the client with multiple medical terms. If they're not understanding the basics, don't use a whole bunch of medical lingo. They're not going to understand that either. And then lastly, shout. The fact that it says shout, I'm not even going to read any further because we don't shout at our patients or clients. And so I think the best answer would be to inform the nurse. And if you're thinking, well, why doesn't the nurse know? Because when a new person enters the room, usually it's the CNA who goes, or the patient care tech, if you're in the hospital level CNA, who goes in and who does the initial vital signs, who welcomes them to the room, who shows them how to use the call bell, etc. And as you're teaching them this and all they're saying is yes, 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 that poses a danger because they don't know how to use the devices. You want to let the nurse know, and if we need to get a translator or something, or a family member to assist in the translation, we can do so. Question 57, the nurse aide gave the client the wrong diet. Which of the following actions should the nurse aide take? Report the error immediately to the nurse. Ignore the error and move to the next task. Remove the evidence of the error. Blame another nurse aide for the error. We're going to own up to it. We're humans. We make mistakes, but we don't want to jeopardize our patients. For example, if you have a patient who has renal failure or kidney disease, they're supposed to be on a low potassium diet. Let's say you gave them something with a lot of potassium in it. That potassium, extra potassium, can actually cause their heart to stop and they go into cardiac arrest. We don't need a patient dying because you don't want to confess to the fact that you gave them the wrong tray. Something similar could be happening with your diabetics. If you accidentally give them a tray that has a whole bunch of sugar, well, now we're going to have to do the glucometer or the finger sticks more frequently. We may have to give them more insulin, but at least it'll be a lesson learned, and we can try to prevent that from happening again if you will report the error. 58, the nurse aide is caring for a client who has bilateral hearing aids. The nurse aide understands that if a hearing aid is not in use, it should be placed in a client's pocket. No. Be left turned on. Nope. It has a little button that you can turn it off and on if it's not in use. Have the battery removed. I've never done that before in my life. Be left on the client's bedside table. Okay, and so it's either one of the last two options. However, when it says be left on the bedside table, it didn't say to put it in a protective, like we'll usually put our hearing aids or the resident's hearing aids in a denture cup, and of course put the lid on it, make sure it's labeled with the word dentures and also the patient's label, so we know who hearing aids, and we'll label with the word hearing aid and also put a label on it so we know who that particular item belongs to. But the fourth item did not say to place it inside of a cup or anything that's going to protect the actual hearing aid, and hearing aids are expensive. So I'm going to go with the third option, although I don't know why a person is not wearing their hearing aids and why they would need to have the battery removed. I just know that is not a nursing or a CNA job duty. So if you choose something else, we'll find out in a few moments whether you answered it correctly and I answered it incorrectly. 59, a family member asks the nurse aide what medication a client is receiving. The nurse aide should allow the family member to read the client's medical list. Tell the family member what medications are given. Refer the family member to the nurse. Give the family member the client's chart. Okay, so even if you know the medication and you have access to the medication list, that is not your role. You're going beyond your scope of practice. Normally, when these family members have questions about medications, they want to know indications, parameters, contraindications, what doctor ordered it. That is not your role. You're going to refer that person to the nurse, and then the nurse can speak directly to them and let them know some of the higher level questions that they, let and respond to some of the higher level questions that they may have. Question 60. The nurse is caring for a client whose religious beliefs do not allow the client to eat certain foods. The nurse aide should report this information to the dietitian, other nurse aides, charge nurse, client's family. All right. And so I know some of you may want to report it directly to the dietitian, but the dietitian cannot take an order from a CNA. you're going to report it to the charge nurse. The charge nurse will then notify the physician, of course, talk to the patient and the family, and then talk to the physician. The physician will then change the diet order. That diet order then goes to the dietitian. And when dietary delivers the tray, hopefully it's going to be aligned with their religious needs as far as their diets are concerned. And so you're going to report that to the charge nurse. All right, everybody, it's time for the big reveal. Let's see if you are smarter than a nurse educator. Let's see what score I made. Whew. All right, I missed one question. My final score is a 98.33. And let's review our answers. All right, so this doesn't give you a rationale. It just lets you know the correct answer. And if it's green, obviously it's correct. And I guess I'm looking for something that's not green and let me know that I answered it incorrectly. All right, so this is the one I answered incorrectly. It says a nurse aide is caring for a client who only speaks and understands a foreign language. Which of the following actions should the nurse aide take? And the correct answer was to use an interpretation guide. Ladies and gentlemen, I have no idea what that means. If you'll please do the research, add it in the comment area below. I would greatly appreciate it. Again, everybody, this is Eunice Mathis. I'm the owner of Florida Training Academy, a nurse entrepreneur who cares, and I help train some of the best CNAs in the state of Florida, and right now, due to YouTube, around the world. So please like our video, subscribe to our channel, and refer this video to other future CNAs. I appreciate you all so much, and thank you for taking care of others. Have a great day. I don't look at the exams before I actually, record myself completing the test. So you get to take the test at the same time I'm taking the test. And at the end, we'll see who has the highest score. It's all in love. It's all in fun. So question number 1, everyone. If a client expresses anger during care, which of the following would be an appropriate response for the nurse aide to take? Why are you being so mean today? You should not say such mean things to people. I will come back when your bad mood is over. You seem upset. Would you like to talk about it? Active communication and active listening are very important. And so as a caregiver, it's not about us doing all the talking. We need to actually listen to our clients and our residents to find out what's going on with them. So the last option seems to be the best to me. Question number 2. A client drinks 240 mLs of soup, 120 mLs of coffee, 90 mLs of juice for lunch. The client's total liquid intake for lunch is, all right, so we're going to do 240 plus 120 is 360, plus an additional 90 would make that 450 mLs. Question 3. When the nurse gives the nurse aide confidential information about a client, the nurse aide should share it with others, keep the information private, discuss it with other staff members in the break room, discuss it with the client's family. And we know about HIPAA, we know about the confidentiality laws. And so we're only going to discuss patient information with those who are involved directly in the patient's care. And we're not just going to randomly give that information to someone in the staff room, okay? So we're going to go ahead and keep the information private. Question 4, the nurse aide should place the client's soiled bed sheets on the bedside table, on the floor of the soiled utility room, in a biohazard bag in the soiled linen container. Normally things that can be washed, even if they have blood on them, if they can be washed, we're going to put those items in the linen container, the soiled linen container, so they can be cleansed. If it was something that was disposable and it had blood or some type of bodily fluid on it, we would place that in a biohazards bag, which is normally red. So I think the best option for question number 4 is the 4th option. Question 5. What is the most important reason for using a mechanical lift to transfer clients? Again, the mechanical lift is kind of like a crane for humans, and they may call it a Hoyer lift, which is a brand name. Whenever you're working a mechanical lift, you have to have 2 persons. One actually holds on and makes sure the patient's stable, and the other one would be operating the mechanical lift.
With that being stated, the first option states that it takes fewer staff to transfer someone. Nope, it always takes 2 people, so that's not fewer. It is the safest method for clients and staff, possibly. It is faster than the other methods. No, it is time consuming, but it's safer. And the last one states that it is the method that clients like best. No one likes to really be lifted up into the air and transferred, so I'm going to choose the second one as the option. Question 6, when preparing to take a meal tray into the client's room, what is the most important action for the nurse aide to take? Check that the client's name is displayed on the tray card. Make sure that the client's favorite foods are present. Keep all foods covered until eaten. Determine if enough fluids have been ordered. Okay, and so the most important action when you're taking the tray into the room is to make sure that the correct person is receiving the tray that they're supposed to be given based on their diet. So I'm going to choose this first option. And you'll be able to see in a few moments if you're smarter than a nurse educator. Question number 7. The nurse aide should use proper body mechanics in order to keep the nurse aide's weight down, protect the nurse aide from injury, keep facility equipment in working order, make a good impression. When you think about body mechanics and lifting with your legs instead of your back, we're going to do that to aid and protect the nurse aide from injury. Question 8, when making an occupied bed, the nurse aide should leave the bed in the lowest position, make the toe pleat, leave the bottom sheet untucked, place soiled linens on the floor. Well, we know the last option is not correct. You don't leave the bottom sheet untucked. We actually want that one to fit securely on the mattress. Making a toe pleat is optional, but what is not optional is at the end of the care, taking that bed down to the lowest position. Question 9, frequent turning and repositioning of the client help prevents cyanosis. That's when a person turns blue. Indigestion, having trouble digesting the food, maybe having some heartburn. Coronary disease, that's heart disease. Pressure ulcers caused some discoloration or changes in the skin condition because the person's been laying in one place for too long. So frequent turning and repositioning can help prevent the fourth option, pressure ulcers. And in most of your facilities, you want to reposition your patient every 2 hours or more often if they're complaining of pain. Question 10, pillows should be used for a client placed in a side lying position to promote sleep, decrease pain, prevent skin breakdown, decrease edema. Okay, so when someone's in a side lying position, also referred to as a lateral position, we want to keep them on their side. We don't want them returning to their back because we turn them to protect their skin, to prevent pressure ulcers. So I'm going to think that the number 3, we use the pillow and place them on their side to prevent skin breakdown is the best option. You don't place someone on their side to decrease edema. You would elevate their extremities, whether it's their arms or their legs, whichever is swollen. Question 11, which of the following is the most important for the prevention of skin breakdown in the client? Air drying the client's skin, rubbing lotion on the client's skin, ambulating the client once a day, repositioning the client every 2 hours. And I just gave you that answer, so we know that the fourth one is the best for question 11. Question 12. When applying elastic stocking to the client, it would be best for the nurse aide to position the client lying down in bed, dangling the legs from the edge of the bed, standing at the side of the bed, sitting in a wheelchair. Now, I want you to think about those elastic stockings, also referred to as compression hose or TED hose. We put those on to improve circulation. And also sometimes when your patients stand up, The blood can go down into the legs. The patient can start feeling dizzy because the blood isn't circulating to the brain. So those compression holds help to keep the blood pressure up. So I think the best option for this one is to put those stockings on while your patient's still lying down in bed. Because again, if you put them on while they're dangling to the side, the blood flow is going to go that way. So that's my thinking, that's my rationale, and we'll see if I'm correct. Question 13. The nurse aide is assisting a client to the bathroom. After the nurse aide uses the toilet, after the client uses the toilet, the nurse aide notices red streaks in the client's stool. The nurse aide should avoid flushing the toilet and report the finding to the nurse. Ask the dietary department to change the client's diet. Tell the client to report the finding to the primary healthcare provider. Understand that this is an expected finding in the older adult client. And so anytime there's a change in patient's condition, you're going to notify your nurse. And so don't flush the stool. You're going to report the finding to the nurse, and red streaks can be an indication that maybe your patient's strained. They could have some hemorrhoids, but it's an obvious sign of bleeding. So definitely let your nurse be aware and ask your patient some questions. Did it hurt when you had your bowel movement? And you can also report that information to the nurse. Question 14. In order to move a client up in bed, the nurse aide should raise the head of the bed. Get assistance from a coworker. Place the bed in the lowest position possible. Wait until the end of shift report. All right, so if you're thinking about it, it's 7 a.m. Everybody is super busy. Those trays are going to be there by 8. You don't want to wait until the end of the shift report to start repositioning your patients. You can try to get assistance from a coworker, but they're also assessing their 10 patients at the same time. So the best response, and if you're trying to help move someone up in bed, is to lower the head of the bed. And you won't be trying to raise the patient in the bed against gravity. So you don't raise the head of the bed in order to move someone up in the bed. So I think the third one is the best option. Question 15, when ambulating the client, the nurse aide should ask the nurse aide for help. Be sure that the client is wearing non-skid footwear. Ask a family member for assistance. Walk in front of the client and show the client the way. All right, so ambulating someone safely, they must always have on non-skid footwear. Question 16, the nurse aide must wear gloves when transferring a client, providing mouth care, dressing a client, weighing a client. And so of these, without any additional information, the most contaminating would be mouth care. Okay, so we want to make sure that we're protecting our clients and protecting ourselves by wearing gloves before rendering or providing mouth care to your clients. Question 17, a client asks the nurse aide, am I going to die? Which of the following is the best response for the nurse aide to make? Your patient could actually, be having thoughts of, they know their medical care, they know their medical conditions. And so this is something that probably has been on their mind. And I think that the fourth option would allow them to express themselves and, actually start the process, either the healing process, the grieving process, but you're going to take that information that you receive and of course notify the nurse so that, as a nurse, I can get additional support. I can get some, counseling. I can get the case manager involved. So I think the fourth option would be the best for this particular client. Question 18. The following diagram represents a lunch served to a client. The client ate only the fruit, milk, and half of the salad. What percentage of intake should the nurse aide record? Okay, so they ate the fruit, milk, and half of the salad. So that would be 10%, 20%, 40%. All right, hopefully you agree with me, and we'll see if we're correct at the end. Question 19, when caring for a vision impaired client, the nurse aide should Ambulate the client by holding the client's hand and walk in front of the client. Tell the client that the food tray is in front of the client after the food tray has been delivered. Provide a dimly lit environment for the client. Announce self before touching the client. Let me just reread that one. When caring for a vision impaired client, the nurse aide should. Okay. I definitely want to announce who I am before I touch them. I'm telling the client that the food tray is in front of the client after the food tray has been delivered. Hopefully the person who is coming into the room and bringing in the food tray has already, started talking to the resident before they set that tray down. So I think the fourth option is best for question 19. Question 20, to promote independence when feeding a client, the nurse aide should inform the client to drink all of the liquids before the solid food. Assist the client in mixing the meat and vegetables together. Allow self-feeding as much as possible. Ask family and visitors to leave the room when the client is eating. So if you want to encourage independence, you're going to have to encourage your patients to help with their ADLs. And ADLs will be activities of daily living, such as eating, drinking, moving about the facility, taking a bath, etc. So for this particular question, during the feeding process, we're going to allow that resident to feed themselves as much as possible. And if you're worried about them making a mess, put a towel or some type of clothing protector over them. But our job as healthcare professionals is to keep them as independent as possible for as long as possible. So we're going to allow them to make a mess in order to, maintain or gain their independence. Question 21. The nurse aide has raised the height of the client's bed to provide care to the client, but the nurse aide has forgotten to bring the supplies needed. What should the nurse aide do next? First, instruct the client to lie still. Second, quickly go get the supplies. Third, lower the bed and place the call light within reach. Fourth, ask the roommate to watch the client while the nurse aide gets the supplies. Well, we know the safest option is going to be to lower that bed and to place the call bell within reach. When you are taking your examination, do not assume that your exam is based upon someone who's in a hospital setting. It could be any adult. So that could be home care, it could be an assisted living facility. And so this option didn't mention raising the side rails, because when you're taking your CNA test, if you do lower a rail, you raise it back up. But if you're thinking about like the home care setting, a lot of those beds don't have rails. So I want you to keep that in mind when you're taking your CNA exam. And for this option, it did not mention rails. However, if you have raised the bed, you lower the rail. If you've raised the bed, you lower the bed back down, and you always want to leave the client with a way to call you. Okay, so that is going to be the best answer for question 21. 22, a client requested the nurse aide call the client's minister. The nurse aide should ask the client why the client wants the nurse aide to call the minister. Tell the client that that is not part of the nurse aide's job. Tell the client that the nurse aide will inform the nurse of the client's request. Call the minister for the client. Okay, and so the third is the best option. You're just going to notify the nurse so that she can assist with that call. Because the minister may have questions, and again, we got to worry about HIPAA, etc. And so I would actually let the nurse address that client's request. Question 23, the healthcare team member who assists the client's performance of activities of daily living is the social worker, occupational therapist, speech therapist, or case manager. And social worker, think of them and the case manager to kind of like two of this, they're kind of like the same specialties, however the terminology or the name has changed, but they're going to help with discharge planning. Speech therapist helps with someone who maybe has a stroke and maybe they have dysphagia or dysphagia, and they can have some speech inabilities or difficulties. That would be speech therapy. They would also help with someone who has swallowing issues. The occupational therapist is the one who works with those fine, motor skills. It can help someone learn how to eat again. If they have tremors, they have adaptive devices. So if someone needs assistance with their ADLs, And of course, if you're the CNA, you know more about this patient than the nurse does. So if you see that maybe the tremors are getting worse or there are some limitations, please let your nurse know. And then that nurse can notify the doctor, and then hopefully they will order an occupational therapist and add them to the patient's care plan. Question 24. What is the first area of a client's body that the nurse aide should wash when providing a bed bath? And of course, we're going to start from clean and work our way down to the dirty areas. So the first thing we're going to clean is going to be the client's face. And just as a reminder, when you're cleaning the eyes, you want to clean from the inner cannula going towards the outer cannula, and you want to switch spots on the washcloth before cleaning the opposite eye, because we don't want to spread pink eye from one eye to the other. So remember, inner to outer, switch places, and repeat that process on the opposite side of the face. 25, which of the following client observations should the nurse aide report immediately to the nurse? Pink nail beds, rectal temperature of 99.6 or 37.5 degrees or 37.5 degrees Celsius, a radial pulse of 110, clear yellow urine. Okay, and so the one that you're going to report that is abnormal is actually going to be this radial pulse. Your normal heart rate or pulse rate for an adult would be between 60 up to 100 beats per minute. And so this one is higher than 100 beats per minute. And this is the outliner. The rectal temperature of 99.6, that's a core temperature. And normally we're okay with our temperatures being anywhere from, high 97s to high 99s. We want to give everyone that gradient. So a temperature of 99.6, in my opinion, isn't something you're going to report to the nurse right away, but it is something that you probably want to monitor. Question 26. Articles contaminated with blood or body fluid should be disposed of in the soiled linen basket, biohazard container, soiled utility room, client's room trash container. And notice this did not say linens, it said articles. So for this one, I'm going to choose the biohazard container, especially since it specifically mentions the blood. 27, the nurse aide should understand that the signaling device must be answered after the nurse aide has made the rounds. Placed on the bedside table at the foot of the bed, that makes no sense. Placed within the client's reach, deactivated for clients with dementia. That's absolutely no-no. So we're going to do the third option. Question 28, when collecting a 24-hour urine sample for a client, the nurse aide should request that the client take a bath or shower before starting the urine collection. Select food items that do not contain red meat. Drink 2 liters of water. No, that would just dilute the urine specimens. Discard the first voided urine. So whenever you're getting your items for a 24-hour urine specimen collection, it starts once the patient voids for the first time and discards that urine. And you want to actually document the start time. And then 24 hours later, that's when the collection period would end. Question 29, when caring for a client who has a hearing loss, the nurse aide should speak very loudly and use gestures as much as possible. Let the client use the roommate's hearing aid. Use only written communication with the client. Face the client when speaking to the client. Okay, when someone has hearing loss, there's a good possibility that they may be able to read lips. So you don't want to exaggerate your words. You don't need to speak louder, but you do need to face the client when you're speaking to him or her. Question 30, a nurse aide is assisting a client with mouth care. Which of the following actions should the nurse aide take? Avoid brushing the tongue with the toothbrush. Brush the outer surface of the teeth by using a side-to-side motion. Floss between the teeth, moving the floss up and down. Floss the teeth before brushing the teeth. Let me go back and read this one. Which of the actions should the nurse aide take? We know that we're not going to avoid brushing the tongue with a toothbrush. We know that we're not going to floss the teeth before brushing the teeth. All right. Side to side motion. You can do circular motions or side to side. All right, so CNAs, I don't know what the answer is for question number 30. Floss between the teeth, moving the floss up and down. I'm going to choose this third one. And we'll see if I'm right in a few moments. Question 31, a nurse aide who wants to demonstrate effective listening skills should plan what to say next while the client is talking. Show no emotion when listening to the client. Finish the client's sentences for the client. Give complete attention to the client while the client is talking. We know that the last option is the best for effective listening skills. Question 32, when a client has memory loss or confusion, the nurse aide should laugh at the client's confused statements, speak loudly to the client, ignore the client, give the client simple step-by-step instructions. Yes, we want to make sure we keep things very simple for someone with confusion or memory loss, because if you start giving them a whole bunch of tasks at once, they're not going to remember it due to their mentation. Question 33, which of the following activities is within the role of the nurse aide? Observing clients for changes in condition, deciding the staging of a pressure sore, suggesting new special diets to clients, giving clients spiritual advice. All right, and so of course you assist the nurse when you're taking those vital signs and you're going in and you're talking to the resident. You're going to be observing for changes in condition, and if there is any change, you're going to notify the nurse. Question 34, the Heimlich maneuver or abdominal thrust is used when the client is having a seizure, choking, coughing, or having difficulty swallowing. Now, one good thing about it, when someone is choking, especially if they're of age, they've been taught the universal choking sign. They cannot say they're choking. They cannot cough, because if they were, you would encourage them to cough because they're not choking. They have a partial obstruction. And so whenever you're going to be doing those abdominal thrusts, that means that person is choking, their airway is blocked, coughing and having difficulty swallowing, even though we use the words interchangeably. That could be a sign of a partial obstruction, but it's not a complete blockage, such as with choking. So if a patient's choking, you're going to perform those abdominal thrusts. Question 35, a new client expressed to the nurse aide, I would love to go to my religious services weekly. What should the nurse aide do? Report the client statements to the nurse. Tell the client's family of the client's wishes. Share this information with another nurse aide to coordinate when to take the client. Not share this information because the client's personal wishes should be kept private. I would definitely provide this information to the nurse. And especially think about it nowadays, a lot of religious services are broadcasted online. And we have computers, cell phones, we have just so many devices that we can utilize to help our patients have some normalcy, or our residents have normalcy. So definitely notify the nurse, and let's see what we can do as a team to work together to, even if the client can't go to religious service, but at least to, help her feel a part of her religious community. Question 36, after cleaning the client's denture, the nurse aide should store the client's dentures in a labeled container wrapped in a paper towel at the nurse's station in the utility room. And of course, we're going to label a container and place the dentures inside of that. Question 37, the nurse aide should understand that a back massage causes muscle spasms, increases blood pressure, promotes circulation, increases heart rate. So whenever you are providing the back massage, normally we do so in circular motions in order to promote circulation. Question 38. A client who's confused. A client who is confused refuses to change from sleepwear to other clothes. The nurse aide should respect the client's refusal and ask the client again later. You all, less is more sometimes. You don't have to go back and forth with these clients. So I'm thinking that the first one's going to be the option. All right, insist that the client changes clothes. Get another nurse aide to help change the client's clothes. Inform the client that the client cannot leave the room without changing clothes. They have them closed, y'all. I'm just happy about that. So unless they're like obviously soiled, I'm just going to respect the client's refusal and not their day clothes for a little bit. Maybe they'll feel better and you can get them changed later in the evening. 39, while the nurse aide is helping a client to the shower, the client falls to the floor. What should the nurse aide do immediately? Report the fall to the nurse. Insist that the client take a bath instead of a shower. Discuss the fall with the client's family member. Inform the client that the client should hold on to grab bars while showering. Well, you're not going to leave that resident. You're going to pull the emergency cord. You're going to activate. You're going to get some help. We need to make sure that nurse gets in the room. And then we can all as a team assist that person up from the floor. If you try to do so by yourself, not only could you make their injury worse, but you can also injure yourself. So we'll do a team lift, get the client back into the bed, and then your nurse can do the assessment. Meanwhile, you as the CNA will be doing things like run and go get, dressings. If they injured themselves, maybe they need a 4x4 gauze, but you'd also be responsible for doing the vital signs. And then once we get everything, once we get the patient stabilized, that is when you can document what happened. Question 40, what should the nurse aide do first when finding out that a client's property has been stolen? Keep quiet and try to catch the thief. Call the family, call the police, inform the nurse. We're going to notify the nurse. Question 41, techniques that promote good communication include avoiding calling the client by the client's preferred name, correcting the client when the client forgets a word, speaking clearly and slowly, informing the client that the nurse aide has a limited amount of time to talk. And so we're going to communicate best by speaking clearly and slowly. Question 42, while the nurse aide is transporting a client to receive physical therapy, the fire alarm sounds. The nurse aide should evacuate the client to a safe area, return the client to the client's own room, transport the client in the elevator to receive physical therapy, leave the client in the hallway and look for the source of the fire. Well, we're going to race, we're going to rescue, we're going to alert, we're going to confine, which could be like close off the fire doors. And then we can either try to extinguish the fire once our patient has been rescued. We can try to extinguish the fire, or in the case where we can't extinguish the fire because there's a huge fire, we would escape or exit. We would leave the building. All right, so which one of these answer options is the safest for the client that you're currently with? And I think it's going to be this first one. We're going to evacuate the client to a safe area. If we are transporting the client and we're between, different hallways, etc., I'm not going to go back and take the client to his or her own room because I don't know where the fire is. So I think that getting the client to a safe area would be the priority. Question 43, a nurse aide is caring for a client who is dependent. The nurse aide decides to reposition the client every 4 hours instead of every 2 hours. The nurse aide could potentially be charged with negligence, battery, assault, libel. Okay, and so it's going to be negligence. You're neglecting your resident. We know that the standard rule is we change or we turn a patient every 2 hours or more as needed. And so the fact that you decide to go against that, you're causing injury to your patient, and that would be negligence. Battery and assault, it's like you physically hitting them, and then libel could be you just like defaming or providing false information about someone. 44, the nurse aide is assigned to a client who frequently expresses concerns about the care the client is receiving. When the client begins to express the concern, the nurse aide should remind the client that no one is perfect, suggest that the client live with a family member, refuse to care for the client until the client stops expressing concerns, listen carefully to show concern and willingness to help. And so the fourth option is the best. Question 45, when giving a bed bath to a client, the nurse aide should cover the client to expose only the part of the body being bathed. This is done in order to assist the nurse aide in remembering the order of the bath, provide the client with privacy and dignity, Keep the bed linen as dry as possible. Make the client aware of which body part is being bathed. And so whenever we're keeping someone covered, definitely privacy and dignity. And I think that's the best option for question number 45. 46, the most important care for a client with a cast is keeping the extremity aligned with the client's body, keeping the extremity elevated. Report a change in the color, movement, and sensation of the client's extremity, making sure the cast does not become soiled. Most important is to make sure that the cast isn't too tight. And so, you know, you're going to be seeing like their fingers and stuff. If they're sticking out of the cast, especially if they have like a more of an arm cast. And so you're going to see if their hands swell, if they're unable to move, they start saying, oh, you know, my fingers are tingling. That's going to be something that kind of indicates that the circulation has changed. And you do want to notify the nurse because that could be a medical emergency and that cast would have to be removed immediately. Question 47, the nurse says providing oral care to a client who's unconscious. The nurse says should place the client in which of the following positions? Well, if you've watched some of our other videos, you know that that's going to be that sideline position. That's going to be turning your resident onto the lateral side. Doesn't matter if it's left or right, but that's going to allow the secretions to accumulate or pool in the cheek area. And then you can use like your little suction wand to take the secretions out. 48, one of the most important tasks in caring for the agitated or confused client is to transfer the client to a mental health hospital for proper care. Request that the nurse administer a tranquilizer for the client, restrain the client until the healthcare provider examines the client, protect the client and others from physical harm. So of course, that's the most important. We don't just restrain someone for the sake of restraining them. And we wouldn't restrain them until the healthcare provider examines the client, because your nurse could call and give a telephone order, especially if it's a behavioral restraint. So right now, let's just try to protect the client and others from physical harm. Maybe, you know, we're going to use some other de-escalation techniques, find out what the client's main concern is. And then if the client is still being agitated or confused and becomes combative, where they're like hitting people or they're pulling out their IVs or tubings, that's when we would consider a restraint. Question 49, and we're almost done, CNAs. When working with a client with Alzheimer's disease, it is important that the nurse aides speak very loudly, approach the client from behind, correct the client every time the client forgets a word, provide a regular routine for the client. Remember, they just like to wonder. They walk around, they forget things. They may go into the wrong person's room. And so they're having so many other concerns. What we don't need is for you to be changing their routine every day. We're going to try to keep our schedules as consistent as possible. Okay, so the fourth option would be the best for someone who has Alzheimer's disease. Question 50, how can the nurse aide best help the client to maintain independence? Allow the client to do as many activities of daily living as possible without assistance. Request that the client's family provide assistance to the client with performing activities of daily living. Do as many activities of daily living for the client as possible. Remind the client to quickly complete activities of daily living. And of course, we're going to allow the client to provide some of his or her own care. And that's how we're going to maintain independence. So the first answer is the best. Question 51, the nurse aide is taking the client's vital signs. What should the nurse aide do if the client's pulse oximetry reading is 95%? Usually that's normal. So normal would be between 94 and 99%. And that's without me knowing anything about the resident's history, because some residents and some patients could have a lower oxygen levels that are okay based on what the doctor has already written. And so if the pulse oximetry reading is 95%, you're going to provide oxygen to the client. You're going to record the finding in the client's chart. You're going to move the pulse oximetry sensor to another location. You're going to report the finding to the nurse immediately. And again, that's normal. We're going to report that. We're actually going to record that in the client's chart. Question 52, which of the following documents would inform the nurse aide of the client's needs? The policy manual, procedure manual, care plan, resident's bill of rights. And so whenever you want to know about the plan for a client, you look at that client's care plan. That's individualized. The nurse has a care plan also, but your doctors, they will write an order, and sometimes those orders will generate a whole protocol, such as how to prevent bed clots, get them out of bed every 2 hours, how to prevent pressure ulcers. We're going to keep them clean and dry. We're going to make sure that we reposition them every 2 hours. Question 53, to orient a new client to the facility, it would be best for the nurse aide to inform the client that it is mandatory to participate in activities, encourage the client to make friends with at least 2 other clients, introduce the client to other clients and staff members, restrict visits from the client's family members during the first month. And no, we want them to feel included, so we're going to introduce them to others. Question 55, the nurse aide has been instructed to place the client in the supine position. The nurse aide should position the client on the clients. Whenever you think of supine position, take the U out, S-P-I-N-E. We're going to place that patient on their spine or on their back. And so the third option is the best. I'm kind of scared. I think I missed about 3 of these questions so far. So I want to see how many of my CNA babies are smarter than a nurse educator. All right, question 55. A client falls and suffers a deep cut on the forehead. What should the nurse aide do next? We know we're not going to leave this client. I mean, that's kind of not even going to read the others. We're going to stay with the client and call for help. If you have a washcloth, a towel, a gown, I don't care what it is, you have a piece of cloth, you could be applying pressure to the forehead in order to decrease bleeding or blood loss. Question 56. The family members of a client with diabetes mellitus brought the client cookies as a bedtime snack. The nurse aide should let the client eat the cookies. Convince the client to drink a diet soda instead. Inform the nurse of the cookies. Substitute fruit for the cookies. I need for you to notify the nurse, and we will, of course, re-educate the patient who has diabetes, and also give some gentle education to the family members who are enabling the diabetic by bringing them cookies at bedtime. 57, after turning and repositioning the client, the nurse aide should make sure that all side rails are up, the signaling device placed within the reach, all pillows have been removed. The bed is in the highest position possible. My CNA babies, if you put all the side rails up on the bed, that is a form of a restraint. So if a bed does have side rails, you have to have a doctor's order for the last 2 rails to be raised. So usually it's the upper 2 rails that are raised, standard procedure in the hospital. But if you raise all 4, that is a restraint. Okay, so we're not going to do the first one. We're going to choose the second option. We're going to make sure the signaling device is within reach so they can call for assistance if they need us. Question 58. The best approach for assisting a client who is vision impaired to ambulate in an unfamiliar area is to guide the client by holding on the client's arm. Offer an arm to the client, walk in front of the client, walk behind the client. And I'm just going to be side by side with my client. I'm going to guide them by holding on to their arm. Question 59, when giving a client a bed bath, it is important for the nurse aide to cleanse the eyes by wiping from the inner to the outer corners of the eye. Ensure that the water temperature is 140 degrees Fahrenheit. No, you're going to burn someone. Uncover the body, uncover the whole body so the linens do not get wet. Wash and dry the skin vigorously. And so the best option is going to be the first one. And I kind of discussed this earlier about the proper technique when cleaning someone's eyes and washing their face. Question 60, to find out what type of diet the client should be receiving, it would be best for the nurse aide to check with the kitchen staff, on the client's room bulletin board, in the client's care plan, with the client's family. And as we discussed previously, if you want to learn about the care plan or what's ordered for your patient, we're always going to follow what's in that care plan. All right, so here comes the moment of truth, you all. Are you smarter than a nurse educator? I think I missed 3 out of 60. Let's see. I missed 4 questions. Yes. All right, so let's see which 4 I missed. All right, so it doesn't tell me there. I'm just going to scroll down until I see a color that is not green. All right, so question number 8. When making an occupied bed, the nurse aide should make the toe pleat. Okay. Let's see the next one that I missed. In order to move a client up in bed, the nurse aide should get assistance from a coworker. Okay, I reckon, yes. I'm not saying they're wrong. I'm just saying that I thought I was right. Let's see the third question that I missed. All right, the third question I missed was, which of the following documents would inform the nurse aide of the client's needs? Procedure manual? All right, so I think that this question is, the answer they have for this question is incorrect. I definitely believe it's the care plan, not the procedure manual. And then last but not least, the best approach for assisting a client who is vision impaired to ambulate in an unfamiliar area is to, it says, offer an arm to the client. And so I reckon what they mean is that the client holds on to my arm versus me holding on to theirs. All right, so everybody, again, this is Eunice Mathis. I love you all. I really thank you all for subscribing to our channel and watching our videos. This is now, it's now March 25th at 12:19 a.m. I just wanted to come to you because I have a very busy weekend and make sure we do a quick review. If you like the video, please go ahead and give us a thumbs up. Also share the video with others. Have a great evening, everybody.
All right, everybody. So hello and welcome. My name is Eunice Mathis. I'm the owner of Florida Training Academy. And in today's video, we're going to do a live practice CNA review. And again, Nurse Eunice, our website is flisInFloridaTraining.com. And we prepare some of the best CNAs in the state of Florida. And right now, even internationally, thanks to YouTube. we're going to go through 20 practice CNA questions and answers. And if you need more practice questions and answers, feel free to subscribe to our YouTube channel. We have hundreds of practice questions available, and we also have playlists that contain questions and also a separate one that contains the CNA skills for the state of Florida. If you're an educator, or maybe you can actually show this video while it is the volume is down, and that will allow your students time to actually answer the questions before they hear my answer and my rationale. So without further delay, let's go ahead and start. Question number 1, which of the following is not a symptom of a stroke? Numbness or weakness on one side of the body, difficulty speaking or understanding speech, chest pain, or severe headache. Which of the following is not a symptom of a stroke? And if you think about stroke symptoms, I want you to think about the acronym FAST. FAST, think of face. What's going to be significant about their face? There's going to be maybe some drooping, maybe some drooling from the mouth on one side of the face. You're going to ask them to raise their arms, but one arm may not raise as high as the other. Speech would be the S. You're going to ask them to speak. And speech may be garbled. Really hard for you to understand garbled speech. And then T, if you're in the hospital, time to call a code. If you're not in the hospital, time to call 911. So let's go through those stroke symptoms again. The acronym FAST: face, arm, speech, time to call. And so with that being said, of the symptoms that are not common for a stroke, the answer is going to be C, chest pain. A stroke is either caused by a blockage or a bleed within the brain. So we'll call it a brain aneurysm. That means that blood flowing through a vessel, it burst, and now there's blood in the actual brain causing damage. And so that person, prior to the actual aneurysm, they could have had migraines, but definitely once that part of the vessel ruptures, they may complain of severe headaches. I mean, like pretty much paralyzing headaches. So that too would also be a sign of a stroke. All right, let's go to question number 2. Question number 2, which of the following is not a sign of dehydration? Dehydration, meaning that the person has decreased fluid intake. And so if someone doesn't have enough fluids, would they have A, a dry mouth, B, dark urine, C, increased thirst, or D, rapid heartbeat? And let me just rephrase the question. Which of the following is not a sign of dehydration? And of course, if they don't have enough fluids, their mouth is going to be dry. The urine is going to be concentrated, which is why they would have dark urine. And if you're lacking something, your body craves it. So if I don't have enough fluids, of course, I'm going to be thirsty all the time. So I'm going to have increased thirst. What you as a CNA would not really recognize immediately if someone has dehydration would be the rapid heartbeat. That's going to happen over time, and that's something that usually the nurses and the doctors will detect. So the correct answer for 2, a rapid heartbeat is not a common sign of dehydration. Question 3, which of the following is not a common symptom of a urinary tract infection? Pain or burning during urination, cloudy or bloody urine, nausea or vomiting, or frequent urination. And a lot of these questions have to do about disease management because you're taking care of patients who are sick and they have these various diseases and illnesses. And we want to make sure that you as a CNA can help detect so you can notify the nurse. All right, so which of the following is not a common sign of a UTI? Anytime you see the word pain or burning, something that's uncomfortable, the prefix is DYS. So we're going to call that dysuria. All right. And so that is actually a sign of a UTI. Cloudy or bloody urine. So if they have bacteria built up within the urinary tract, that pus, those pus cells, that is what makes the urine so cloudy. The prefix for blood is hema. And so for bloody urine, we call that hematuria. Don't ask me where the T comes from, but hematuria, that would be bloody urine. Nausea or vomiting, Those are two different systems. So we have our urinary system and then we have our GI, our gastrointestinal system. So I'm thinking that C is not the correct answer because it's a totally different body system. And then D, frequent urination. Yes, if your urinary tract is irritated, you're going to be urinating more frequently. So the correct answer to number 3 is C. Nausea and or vomiting is not a common symptom of a UTI. Question 4. Which of the following is not a common symptom of depression? Feelings of hopelessness or worthlessness, loss of interest in activities, weight gain, difficulty sleeping. And so think about an older person who's depressed, who's lost their will to live. Which of these would not be a sign of depression? And the answer is going to be C, weight gain. Usually, when someone's depressed, they're not eating. They're going to have insomnia because they're stressed, they're worried, and they're not going to want to participate in activities. And if you see that happening with your elderly patients or with any clients within your care, you want to make sure you notify the nurse so we can get a doctor on board, and maybe we can help this person get the extra care that they need. Question 5. What is the normal range for a resting adult's pulse rate or heart rate? A, 60 to 100 beats per minute. B, 20 to 40 beats per minute. C, 100 up to 120 beats per minute. Or D, 120 up to 140 beats per minute. Drum lines, please. Let's see what the answer is. Yep, if you chose A, you are correct. The normal range is 60 to 100 beats per minute. If C seemed like it could have been the best answer, that's because if someone's in cardiac arrest and you perform chest compressions, you want to compress at least 100 up to 120 compressions or beats per minute. And of course, B is just entirely too low. If someone's heart rate's that low, that is a medical emergency. Please notify your nurse right away. Question 6, which of the following is not a common symptom of a heart attack? All right, so what happens with a heart attack? What is happening internally? There is a vessel within the heart that is blocked. So that means there's not enough blood flowing through. And of course, oxygen is carried within the blood. So a part of the heart is dying. So which of the following is not a common symptom of a heart attack? Chest pain or chest discomfort? Shortness of breath, we talked about it. You're having decreased oxygen circulating. Nausea or vomiting, rapid heartbeat. And so sometimes when people go to the hospital, like, hey, I have really bad epigastric pain, or I'm having really bad indigestion, we go ahead and we do a full cardiac workup on them because the systems are so close together. Sometimes it may feel like it's heartburn, but it could actually be chest pain that's actually traveling. So for this answer, question number 6, the one that is not a common symptom of a heart attack is rapid heartbeat, right? So if someone's having palpitations or they feel like there's a horse racing in their chest, that's usually not a sign of heart attack per se, but it could be something else that's wrong with the heart. Question 7, which of the following is not a common symptom of a stroke? All right, for you all, this one, blame it on my mind, not on my heart. I repeated the same question twice. We already answered this question. And the one that's not a common sign of a stroke was C, chest pain. All right, so you got a freebie there. All right, question number 8. Which of the following is not a common symptom of hypoglycemia? Anytime you see the prefix hypo, that means that something is low. Hypoglycemia refers to the blood that's within the actual, refers to the sugar that's within the bloodstream. So if someone has a hypoglycemic episode, would they have shaking and trembles? Would they be sweating? Would there be confusion? Would they feel thirsty? And I want you to think about it. When you've had a long day and you've not had an opportunity to eat, sometimes you do start feeling shaky and you're like, man, I'm shaky. I need to go ahead and eat something. We call it diaphoresis or diaphoretic whenever your patients just start getting really sweaty. That too is a sign of hypoglycemia. Sometimes when the sugars become so low, the person can become lethargic, hard to understand. They're in a confused state and it resembles a stroke. So yes, A person who has hypoglycemia could also have some confusion. So the incorrect answer, or the one that is not a common sign of hypoglycemia, for this one would be the actual D, feeling thirsty. If a person is feeling thirsty and they're a diabetic, more than likely their sugars are high, not that their sugars are low. So thirstiness and polyuria, urinating a lot, is a sign of high blood sugar, hyperglycemia, not a sign of hypoglycemia. Question 9, which of the following is not a common symptom of pneumonia? With pneumonia, what organs or what system are we speaking of? We're speaking of the respiratory system. And so that actually starts off at the nose. You have your mouth, go all the way down your trachea. And then, of course, we have our lungs. And so we inhale oxygen, we release CO2. Which of the following is not a common symptom of pneumonia? Coughing, fever, chest pain, diarrhea. All right, and so if someone has that accumulation of fluid within their lungs and they're constantly trying to clear that fluid out, they will cough a lot. And also because pneumonia is an infection, whether bacterial or viral, it could be an infection within the lungs, they will sometimes have an increased temperature or a fever. And because they're coughing so much, they can also have some chest pain. So the correct answer is going to be D, and plus D is a different, system altogether. D is talking about the GI system when it's referring to diarrhea. Question 10, which of the following is not a common symptom of Parkinson's disease? And sometimes we start combining disorders. For example, if a person has a sign above their head that says that they're legally blind, above the head of the bed that says they're legally blind, we'll go into the room speaking really loudly. And the person who has a vision deficit will sometimes have to tell us, hey, I'm sight impaired. I'm not hard of hearing. And so when you think about somebody who has Parkinson's disease, it does not mean that they are confused. You just have to give them time to answer your questions and know that because of the neurological disorder that they have, they sometimes move a bit slower. So with that in mind, let's answer the question. Which of the following is not a common symptom of Parkinson's disease? Tremors, slow movements, memory loss, or stiffness? And the one that is not a common symptom is going to be memory loss. Remember, just because someone has Parkinson's disease does not mean that they have Alzheimer's or dementia. So when you ask them questions, just ask them questions that can be answered yes or no, and have the patience and the time for them to actually respond to you. Normally, as the day progresses and their medicines, and they've taken their medications, their movements will become more smoother. They'll be able to move better. They'll be able to assist with their ADLs. But of course, as the time and the medication wears off, as time progresses, they're going to return back to their Parkinson's state. And every morning we repeat this cycle. We have stiffness, we loosen up, we have a good day. And then by evening, they're, pretty much with the tremors and the really shuffling walk again, or gait. Question number 11. Which of the following is not a common symptom of Alzheimer's disease? A, memory loss. B, difficulty with language. C, increased appetite. D, disorientation. And I know you all know this answer. Yeah, if you said increased appetite, which is not a common symptom of Alzheimer's disease, sometimes they forget that they even ate, you all. So you want to make sure that as a CNA or a caregiver that you keep those routines, that if you notice that they didn't eat enough because maybe they start wandering around, that maybe you can provide them with a snack and talk to your nurse, figure out what's most appropriate for them. In some of your facilities, they'll have like nutritional shakes or nutritional puddings, but usually they don't gain weight. They actually can lose weight, and you want to be mindful of that. Question 12. Which of the following is not a vital sign? Blood pressure, temperature, respiratory rate, weight. And this was an easy one. Weight is not a vital sign. So if you're thinking about how someone's, hemodynamically, how their heart's pumping, how their lungs are doing, we're going to be doing the blood pressure, the temperature, the respiratory rate, and also blood pressure, temperature, respiratory rate. We're going to be getting those vital signs, and also pulse. It's not listed there. Those are your normal vital signs that you get on your patients at least once per shift. Weight, while important, we usually do a weight just to make sure that we're understanding our patients' nutritional needs, and we'll also do a weight to see how their disease state is progressing. For example, congestive heart failure. If they're gaining weight, well, then we know that they have fluid overload. Another reason why the nurse will have the CNA take a weight is because some of our medications are weight-based. And if we are just guessing, we can give a person too much medication and it could be toxic to their kidneys. Question 13, what is the normal range for an adult's respiratory rate? A is 12 to 20 breaths per minute, B is 20 to 30, C is 30 to 40, and then D is 40 to 50. How fast should an adult breathe normally? And if you said A, 12 to 20, you're absolutely correct. Question 14, which of the following is not a common symptom of an allergic reaction? Not a common symptom. A, hives or rash. B, difficulty breathing. C, nausea or vomiting. D, rapid heart rate. So what happens when a person who's allergic to a bee gets stung by a bee? What do you think will happen? All right, and so yes, they will have hives and a rash, difficulty breathing. They could become nauseated because that's something that's foreign within their body, but this is not something that's going to happen immediately. That rapid heart rate, if they do have a rapid heart rate, sometimes it could be due to anxiety, not necessarily due to the allergic reaction. Question 15, which of the following is not a common symptom of a seizure? So whenever the brain is firing too much, what could happen to the actual person? A says loss of consciousness as not a common symptom. B, jerking movements of the arms and the legs. C, arm pain. D, staring spells. All right, and there's different types of seizures. You have the petite, and then you have like the grand mal. And so sometimes people just stare off in space and you don't even know it, but your patient could be having seizure activity or seizure-like activity. And so if you're unable to break them out of it, you're going to notify the nurse. Or if you just see someone, sometimes even like their little finger could be moving. And so something like that, we can do like an EEG. So instead of an EKG for the heart, we can do something similar for the brain to actually see the brain, the waveforms, and we can help determine whether or not this person's having a seizure or not. So question number 15, the correct answer, as far as the one that is not a common symptom of a seizure, is going to be C, arm pain. Question 16, what is the proper way to assist a patient with using a walker? Hold the walker for the patient and walk in front of them. B, hold the walker for the patient and walk behind them. C, allow the patient to hold onto the walker and you walk beside them. D, do not assist the patient with a walker. All right, so the question stated that you were going to assist, so we know that it's not going to be D. And we don't want to hold on to the walker. We need the patient holding onto the walker, and we can walk beside them. And one of the safest devices to use would be a gait belt. And while they're walking with the walker, you're actually holding onto the gait belt to provide some extra support for your resident. And so the correct answer for 16 is C as in cat. Question 17, what is the first thing a CNA should do when encountering a confused patient? A says call for help. B, attempt to calm the patient. C, restrain the patient. D, ignore the patient. And so it didn't say combative. So don't get the terms combative and confused. They are not interchangeable. This is not a person who's fighting you. It is somebody who is confused. And so you can I would first do B. I would attempt to calm the patient, try to figure out, what is causing their confusion. And then after that, of course, I'm going to call the nurse if I'm not able to assist. But we do have patients who are confused, especially if you're working at Alzheimer's unit. So if you're calling the nurse every time there's a confused patient, unless it's a new onset confusion, like they've never been confused before, your nurse is going to question, your critical thinking abilities as a CNA. And so if a person has confusion and they're confused at this particular moment in time, you're going to do B. You're going to attempt to calm the patient. Question 18, what is the proper way to provide oral care to a patient who is unconscious? This person is not moving. More than likely, they don't have a strong gag reflex. You can test the gag reflex with a tongue depressor. If the person moves when you put the tongue depressor towards the back of the tongue, that means they're less likely to choke. But regardless, if a person's unconscious and you're providing oral care, usually we don't sit them up to provide oral care. We have them on their side so that any secretions that pull would do so in the cheek area. All right, so let's read these answer options. The proper way to provide oral care to a patient who is unconscious, A says, brush their teeth vigorously. B, use a swab to clean their mouth and their teeth. C, use mouthwash to rinse their mouth. D, no oral care is needed for an unconscious patient. And of course, that's wrong, because pretty much if the mouth is dirty, the whole body is dirty, because they can get respiratory infections. I mean, beyond the oral benefits of mouth care, we want to make sure our patients don't become septic, and we don't want them having cardiovascular diseases due to having a dirty mouth. So the best answer for this one is going to be B. You don't want to be brushing someone's teeth vigorously, because that can make them bleed. And it's sometimes a little bit harder to brush the teeth of someone who's unconscious. And so the safest thing is just to moisten a swab. Usually they have mouthwash or some type of peroxide type solution. You can wet the swab and go around their teeth, their gums, and their tongue with that. And that is how we cleanse the mouth of someone who's unconscious. And if your facility has a little suction wand, you can suck out the secretions. You can remove them a little bit easier. Question 19, what is the proper way to position a patient who is immobile? Immobile meaning that the person cannot move. Are you going to put them A, on their back with their head slightly elevated? Potentially. B says on their side with a pillow between their legs. What is the purpose of putting a pillow between the legs of a patient? Well, you're preventing the bony prominences. You're preventing the bones, the inner knees and the inner ankles from touching each other. Any place where bone is touching bone or bone is touching bedding, that is a place where a pressure sore is more likely to develop. And so for right now, from what I read, B seems to be the best answer, but let's continue reading. Do you want to position them in a fetal position? Well, if you put them in a fetal position, they can become contracted or locked like that. So that's not something that we tend to do. And then D, any position is fine as long as the patient is comfortable. No, because sometimes they have a tendency to curl inward. And even though they may be comfortable, we still need to perform range of motion on them. Maybe put some pillows beneath their arms and between their legs so that they don't return to that fetal-like position. And the best answer for question number 19 is going to be B as in boy. Okay. Again, we're going to prevent those bed sores or those pressure sores on the inner parts of their legs. Question 20, what is the proper way to provide range of motion exercises for a patient? Move the joint as far as it can go without causing pain. Move the joint as quickly as possible. Only move the joint once a day. Do not move the joint at all. Well, I know you all know the answer to this one. We're going to exercise them according to their tolerance. So the answer to question number 20 is going to be A as in apple. All right, everybody, you did it. We did 20 practice questions on a Sunday. I just want to make sure that you all keep practicing questions and skills daily until you take your test. So whether you are a CNA student or a pre-nursing student, I hope that you find value with Florida Training Academy and our YouTube channel. We have hundreds of CNA practice questions and also skills videos that are available for you within our playlist. And you can find us on youtube.com/Florida Training. All right, everybody, my name is Eunice Mathis. It's been great spending these 25 minutes with you, and you all have a great day. Bye.